oh, thank you, Ellen. We have asked for those reports on the lawsuit and the special master's report. If you've been watching the news lately, you've seen that the neutral has been hired as part of the class action lawsuit. A gentleman from out of state who has done that kind of work before with other states where there have been lawsuits, and has a long track record of working and improving systems in different states. So if you haven't checked the news, just Google class action lawsuit Oregon, and you can find the articles and link to his bio and information. So I don't know more about the timeline, but hopefully they'll give us an update. Let's see, pull the agenda back up. All right, switched pages. Where did it go? I have lost the agenda.
Would you like me to share it?
Yeah, will you review the agenda real quick and ask if anyone has any feedback or edits when I find it? Oh, here I am. I pulled it up now. Okay. So, order of business, we do have our minutes. We do need to revisit the secretary role. Alicia is needing to not continue in that position, so we need to do an election on that and then talk about our upcoming work. We are going to hear from OKID again on the child data set, which we've heard from several times. Those of you went to the special workshop they put on for us. We'll get more update on that. We'll hoping to hear from child welfare with some special requests we had for information on next steps around those two things I talked about. And then we really need to talk about retreat planning and next steps. So what are our goals from the retreat? What are our hopes and dreams to accomplish together for our first time in person since before COVID? And then we'll wrap up. So we might make it out early today. Any feedback on the agenda? Anything that we're missing? Thanks for pulling that up.
Does anybody need to see it further, or do you have your own?
All right, give you a couple seconds. Malik, I see your hand.
Yeah, I think I just had some questions about like the state of the IOP contract stuff. So I was hoping to hear back from child welfare on where we're at with that and things like that.
Yes, definitely bring that up in that section if it's not mentioned when they come in. Thank you.
Does anybody need me to keep the screen up, or are you okay with me closing it? Okay, great.
I think close it. Thank you, Ellen. Great, so order of business, we do have a quorum, so let's go ahead and approve our minutes. Anyone wants to make a motion to approve the June 2024 minutes for that special meeting?
I'll move to approve the minutes from June 2024.
Second.
Right. Megan first, Casey second. All in favor?
Aye.
Please give an aye or hand. Any opposed? Any abstaining? All right, minutes are approved from June. Thank you very much. Get those saved into the system. Thank you, Ellen, and whoever took notes in June. I don't remember who took them.
Alexis did.
Oh, that's right, Alexis. Thank you so much for taking notes for us. Jumping into your first or
anytime.
Much appreciated. So secretary role. So this time we're going to open the floor for elections for our secretary position. If you don't know anything about it, I'll ask Alicia to share a few words, but the secretary is one of the 3 members of the kind of leadership committee for the commission. You have the chair, vice chair, and secretary, and that position is really to support us in note-taking, processing, working with Ellen to make sure that those get finalized before and after each meeting, and working on the leadership team to help plan between meetings, do prep sessions, maybe a little heavier lift prepping for the annual retreat, and those sorts of things. But Alicia, as the outgoing secretary, would you like to share a few words about your experience and what that looks like?
I would say that it was a growth thing for me. So I've learned a lot doing, meeting with Pamela and Ellen and Mama Do and leadership. kind of doing planning and then just, you have to kind of multitask a little bit during the meeting. So that's something that if you're not wanting to do, don't step up. But I mean, I feel like it's a good way to build relationships with people on this team individually. And just being able to type during the meeting. There's nothing, it's not really hard. It's just, it's not hard. It's just something that, you have to get used to multitasking. That's the only, I think, the growing part for me was. But I think you, oh my goodness, I can't talk. You explained it really well, Pamela. Thank you.
Great. So I guess at this time, would love to open the floor to anyone who would like to put their name forward as a candidate for the secretary position and join us on the leadership team. And then we can vote. If there's anybody who's okay with taking notes.
So if anybody is thinking about stepping up, I can't add another standing meeting, but I'm happy to be back up and take notes during these meetings because I have blocked them out. So if somebody wants to do half of it with me and do the planning part, I'm happy to do the note taking.
Oh, you're lovely. Thanks, Judge Co. So we have an in-meeting backup at least. Nobody else? And Alexis says she's happy to jump in for notes too. Thank you so much. Some people are very good at that and it doesn't mess with their ability to participate. And for others, you know, you kind of lose yourself in the meeting and don't get to participate. So I totally get it. For me, it depends on my mood. Some days I can do it and participate, and others I just can't. So.
And that's a good point too, that Alexis says it keeps her focused. For some people, I think it is a focusing tool.
All right, well, I hate awkward silences as much as the next person. If anyone is interested and wants to step forward later, I think, I don't know how it works exactly, Ellen, will continue to hold space for it. And you could
fine. I mean, we can have Alicia on in name only. And I think that then allow for the flexibility of who does the notes at the meetings, like we just established that at each meeting.
Okay.
As far as the leadership participation, because generally, oftentimes it's the chair, vice chair, and me, and we can't do 4 people because that becomes a public meeting. So that's fine also. So if we are doing it in this way, I think we're fine to do that for now. And there's nothing that says we have to be rigid. So.
And the secretary was a new position, I think, maybe 3 years ago.
Yeah.
That was added.
And now with the public meeting law having changed to, then I think it makes sense. So we can just have a growth mindset about it.
Yeah, wonderful.
Judge Jacode, would you want to try to do it today after because I have to step out at 10:30.
Sure, that's fine. I've already started.
Okay. You started doing the notes already?
Yeah, I just
Oh,
usually
okay.
do.
What I can do is email you what I have and then when I leave, and then so I think I have your email in the invite. I'm sure it's in there.
Yep.
And then you can just start after the break, probably around there.
That sounds great.
10:30, whatever that is. Okay.
And
Thank you. I appreciate you.
Pardon me. And we use the format of the just the agenda. So just using the agenda provides a great format.
Yeah, and now because of the public ethics rules, we have to record our meetings and post them online anyway. So a lot less pressure, I think, to have really detailed notes.
Yeah.
So if someone wants those details, they can go watch the meeting live if they were so inclined.
Perfect.
I also wondered if we could can we talk about maybe a different time for this meeting? Or am I the only one that kind of finds Mondays hard? Like, we don't have to do it right now, but
I think
Could-
Mondays are tough. Yeah.
yeah, so I don't know if we can add that to the agenda at some point today.
And you
Yeah.
know, that might be just a thought. We only have a short number of meetings left for this year. We have the September meeting that's in person, that's already calendared. And then we have the November meeting, and those are the last two meetings of the year. So it might be a discussion that we could take up that would be for the next year. That way people could get it calendared.
Good
Because we
point.
don't, also for people who have calendared it. Look at it.
Yeah, thanks, Alan. That's a good point. So
Yeah,
between
there's only two more meetings left and one already planned.
and for in-person too.
Yeah.
Alrighty. And then we obviously didn't do introductions right off the bat. We wanted to get through the things that needed voting before I know folks have to leave. Oh, Jamie's asking no August meeting.
No,
No, I
there
think-
would be an August meeting.
Yeah, every other month. We added the June meeting in because we needed to talk about those recommendations. Yep.
And because we didn't
Sorry
have,
about that. I know that, and it just, for some reason, I got in my head that this was a monthly meeting. Thank you.
well, I bet you're happy it's not. Remember, because of your new job and all the things you've got on.
Right. A lot going on.
Yeah.
So
So
I
no,
would love to pause and do introductions if we could.
we also have public comment here today as well. So,
Oh, I don't see it on the,
we do, right there after the introductions.
oh, there we go. I jumped ahead. All right, well, let's do introductions and then open for public comment. I apologize, everyone, for just jumping into the business. I just get worried about losing quorum and not getting things done. So let's circle back and do introductions. I don't know, Ellen, if you had a nice prep question for us this meeting.
No, not really. But what I would say, you know, whatever you'd like to say about yourself, just your interest in this meeting today would be, I think, a good way to begin. Do you want to start, Pamela? And circle back.
Yeah,
to-
and then go ahead and nominate the next person when you go. Just keep it moving
Yeah.
quickly.
Absolutely,
Pamela
let's do it.
Heisler, chair of this commission. In my day job, I'm with Oregon Child Abuse Solutions. So hi, Carissa. We've talked on email before, working with the Children's Advocacy Centers, which I really love, and have a background in child welfare and work and represent many hats here on the commission, including an alumni of foster care. And I will go with Jamie.
Good morning, everyone. My name is Jamie Paris. I am a birth parent of children who have been in the foster care system, and I have worked as a parent mentor for parents for many years, and I just switched for parents whose children are within the foster care system, excuse me, the resource care system as well. And I currently have switched jobs, but I still have absolute dedication to families and preservation. Thank you. Let's see, Jessica.
Hello, good morning. Can you hear me? Okay, awesome. My name is Jessica Hawash, and I am a woman in recovery. That's what initially brought me here. But I have also served on both sides. I've been a foster parent, resource parent for many, many years. I've owned sober living houses. So I've kind of just been all over the place, but my passion for this work is this is our next generation of our speakers. And so anything that I can bring to the table to help end that generational trauma that's going on, to bring really strong adults into the world is why I'm here. So thank you.
And who do you nominate?
Oh, I nominate, oh gosh, Alicia, go ahead.
Hello, I am Alicia Richard. I am the secretary in this commission, and for my day job, I work at the Parent Mentor Program through Morrison and Clackamas County. I'm the program supervisor here, and I'm a person with lived experience, both as a child in foster care and a person being a parent in the child welfare system. I'm also a person in long-term recovery. And I think I have compassion and passion for the kids and for the parents. And so I advocate for both. I kind of like go back and forth between the roles and providing lived experience. And I'm always about system change because I believe that we can always make things better. So that's why I'm here. Let's see, Malik.
Okay, sorry. Malik Alexander, I am with New Avenues for Youth. Here and a part of this group because of my passion for uplifting youth voice and kind of on the note of what Alicia was saying is system change. And so, yeah, glad to be here with everybody. Thank you.
Would you nominate? Sorry, I didn't catch you before you muted.
Megan?
Okay, good morning. I'm Megan Jaco. I was an attorney for parents and children in the system for many years, 19 years. Then I was a juvenile judge for about 7 years. Now I'm on the Court of Appeals. So I only occasionally get one of these cases, but my passion for improving the system, I've seen it work good. I've seen it work not very well for people that have experience in the system. And so I continue to want to contribute and help make the experience with touching the foster care system better for Oregonians. And I'll nominate Casey.
Hey, good morning, everybody. My name is Casey Dreer. I'm a commissioner. I'm going to be a little quieter today because I've got an inner ear infection. So I'm just kind of sitting back watching and contributing where I can. I'm a juvenile dependency attorney, so I represent kids in foster care and parents. And my passion for this, as you all know, is that, you know, I'd like to see a system here in Oregon that's really kind of the gold standard for foster care throughout the nation. I hate, you know, when we use everything federal to evaluate how we're doing when I think we could be so much better. And I'll nominate Alexis.
Good morning. I'm Alexis Amarelli. I am the newest foster care ombudsman with the Governor's Advocacy Office. I have been in this role for about a week as the only FCO with the Governor's Advocacy Office. So I'm still very new to this group, but I'm very happy to be here. I myself have also experienced foster care as a child, lived in and out of foster care until I was ultimately adopted at 13 years old by my foster parents. So have some great lived experience, some good and some really bad experience, but I lean into it. And I feel like everything that I've experienced personally has really been for a reason, which has kind of led to the professional choices that I've made. I have worked numerous nonprofits, drug and alcohol counselor. I have also worked at Hearts with a Mission, which is a teen homeless shelter. I was an ombudsman for the United States Coast Guard, and I joined the state of Oregon with child welfare in 2017. So there I did CPS, permanency certification, kind of the whole array of different roles with child welfare. And now I find myself here where I can take my professional experience as well as my lived experience and kind of bring it all together into this nice little package and lean into it. I think one of the coolest things that I've seen so far in this group is the recommendations. I feel like I've come at a really awesome time. I myself am learning about recommendations because I will write them as well in my position. So I'm really excited to be able to learn about that from this group. And to obviously be a part of that accountability for the foster care system and all that good stuff. So who has not gone? Seema.
Hi everyone. Sorry I have to be on camera today. It's good seeing you all. Well, I'm a commissioner on this commission, and I'm a former foster child, also the founder of Oregon's Project Never Again. I love how everyone said sort of lean in and advocate for the system, for children in the system. And that's pretty much why I am here, to give kids a voice through my lived experience and everything that I think I've experienced through the nonprofit that started about 8 years ago. In addition to that, my day job, I would say, I'm a performance auditor for the state board. So I love working with y'all. Thank you. Thank you for sharing. And let's see, who else is left? Ellen.
Hi, Ellen Bell, and I am the coordinator for the commission, the staff essentially. And I'm just really happy to be here today and to serve you. This is passion near and dear to my heart. And I'm gonna let the rest of you talk more about yourselves because we have a few more people to go. And I was thinking we could probably end with Carissa, and that way she could launch right into her public comment if that works for you. And I will go to Deanne.
All right, thank you. I'm glad to be here. So I am the the advocate for foster youth on this commission, having been in a foster home as a youth. My mother also went into a foster home when she was younger, so there's some intergenerational experience there. We're both Latino as well, so that's led to that sort of unique experience of being divorced from our culture to an extent. Excuse me. And the reason I'm on this commission is for a few things. So I really want to see every foster youth be able to get a good job, live a good life, and be able to be emotionally and mentally supported. These are the basics. And it ties into my greater focus on supporting the poor, supporting the people, ensuring everyone has equal opportunity and is able to essentially rise to their best self. So sort of universal meritocracy in a sense. And I've been in public service for several years now. In fact, I'd argue that as an autistic person, public service is something of an autistic fixation, actually, whether it's as do you want me to stop, Pamela? Oh, okay. Whether as if it's like running and serving in office or working on government commissions like this. And so I serve on the Oregon Autism Commission, a social services co-chair and a self-advocate for the autistic community, and the Portland Children's Levy Community Council. And what I pushed for in the past few years has been, ever since I got involved, has been very consistent. More job training opportunities, employment opportunities, stuff like that. Better and more holistic mental emotional health. Stop over clinicizing it. That's my big thing. We are social creatures. We need to get people good social circles if they are going to be truly healthy, as well as addressing affordability, especially since a lot of people in both these communities, whether it be foster youth or autistic community youth in general, struggle to get good employment these days, especially for the autistic and foster youth community, because it's a lot more risky for them to go to college. And oftentimes for the autistic community, they have very niche interests, which means it's very hard for them to get good jobs. So that's a little bit of it. I am 100% dedicated towards improving the system. I know we have a lot of problems, and some of that has been improved lately. So I'm big on solving problems. So I hope to be able to be a problem solver on this advisory commission and do the best work I can to ensure that we reach one step towards that goal. Thank you.
Thanks. I believe that Gretchen is going to introduce her team, but do we have any other commissioners that haven't spoken yet? Then we can jump to Gretchen, and then we also have
public comment.
And then public comment, right?
Oh yeah, I guess Gretchen introduced and then we'll go to public comment. Thank you.
Great. Hi, everyone. Good morning. Thank you so much for having us back again. I'm going to make this quick because we're guests and you'll be hearing from all of us in just a little bit. I work with a great team with the Oregon Child Integrated Data Set. I'm joined by 3 of those team members. I have 2 analysts who will be presenting to you, Dylan Mixachek and Amelia Harju, and then also Becky Griffin is with us as our engagement specialist on the project. So we'll keep our intros short, and our main goal of being here is to figure out how we make OKID work for you all and other policymakers in Oregon. So we will pause on our side and we'll talk to you in a little bit.
Thank you. And I just want to say welcome to Rachel. Thank you for jumping in. I don't know if you want to quickly introduce yourself before we open for public comment.
Sure, happy to. Hi, everyone. Rachel Kearns Henry, she, her, Senior Human Services Advisor. Happy to be here today.
Thank you. So now we can open the floor for public comment. And Carissa, if you have anything you'd like to share with the commission as our one of our guests today, this is your chance, or any thoughts, recommendations, things you've seen in your work.
I was not planning on making really any comments. I was planning on eavesdropping the whole time and just hearing what this group talks about. And I can tell you a little bit about myself, and my interest in this is, so I've been doing child abuse pediatrics for 13 years, and about 6 years ago, I realized that we had lots of gaps in medical care for kids in foster care. So referrals would get dropped, kids wouldn't get well checks, they wouldn't get vaccines. There were just a lot of gaps. And so we started a care coordination program for Lynn, Benton, and Lincoln counties in 2019. And it's been great. We've done a lot of good as far as making sure kids get every 6 months well checks, following the Academy of Pediatrics guidelines, getting kids labs that might otherwise have been dropped, and referrals and things like that. So I'm very interested in seeing what we can do statewide to ensure kids throughout the state get that same kind of quality care and care coordination for their medical needs. So I'm just gonna listen in and see what can be done.
Dr. Cousins, can I ask a question? Mm-hmm. Do you have a staff person that's on that all the time?
So we have a team. We have 2 care coordinators. They are not RNs. They have diverse backgrounds, but they kind of do that day-to-day following up with DHS, following up with the primary care offices. And then we also have a pediatric nurse practitioner who can see kids if the primary care providers can't. There are lots of different models of care coordination for kids in foster care. We kind of developed our own based on some surveys from our primary care providers and what they wanted and what would work well in our community.
Is there funding for that, or do you just absorb it because it works better?
Yeah, so we actually have a value-based payment contract with the CCO. So we get a per member per month rate, and that funds our team. And we've also been able to, since we started our program, we've been able to meet the OHA metric for youth and children in foster care. And so we also get that coming into our CCO.
Awesome.
Yeah.
Wonderful.
Yeah, it's a great program.
We might have to have you present that at membership, Carissa.
Yeah, I would love to. My dream has always been to have this network throughout our state of these programs, because when we send, when kids are transferred out of our area, out of our CCO area, we don't have the ability to follow them. We follow about 300 kids. So each of my care coordinators has 150 kids that they're keeping their eyes on, which is a lot. But when we send them, when the child goes out of the area, we send the caseworker a summary of the medical needs of that child, any pending referrals. We provide that to the caseworker, and we just have to trust that someone else will take that over. And it's not always a great feeling, because we've had kids come back to our area and those needs weren't met. So we would love to see this spread statewide.
And do you work with Dr. Marshall?
No, I don't know Dr. Marshall.
Interesting. Okay, because we were also contacted, or I've spoke this week with Becky Marshall, who, similar to you, is working with youth and foster care from a medical perspective. And she was potentially going to be here today. So I thought, well, maybe you two are connected, but.
No, I'd love to connect with her though. Where do you know where she is?
OHSU.
Oh, okay.
I'm writing that down.
Yeah, no, any more, the more connections we can have, so kids can, kids transfer from area to area, and if we can do anything to kind of smooth that transition of their medical care, that's what we need to do.
Absolutely. Well, thank you, Carissa, for coming and for sharing that. And I think definitely will follow up with you in my other hat. I
Okay.
think it's
Sounds good.
something we should be talking about across other CACs.
Yes, yeah.
Any other questions for Carissa? All righty. Thank you so much, and observe, and we won't put you on the spot again. Thank you for being gracious.
Yeah.
You
And
want
Adam,
Oh, I was just
I
going to say,
missed
if you want to
you.
put contact info in the chat, then I'll reach out to you and we can have further contact and something in the future. Thanks.
Okay, thanks.
Yeah, and I have her email too if we need it. Adam, I didn't mean to skip you in the intros. If you're able to hop on and introduce yourself, I apologize for that.
No worries at all. I'm just here eavesdropping as well. I'm Adam Rodakowski, he, him pronouns, Director of Foster Care at Greater Oregon Behavioral Health. In my day job, I also am one of the chairs of the System of Care Advisory Council. So, and most of my day-to-day work is in the child welfare space. And so I'm very interested in the work you all do and appreciative of it. And so when I am able, I like to just jump in and listen. So thanks for having me.
Love it. Thank you. All right. I think I covered everyone now, right? Anybody I missed? Wonderful. So public comment is closed now. And I think we can pass over to Gretchen if she's ready. I know we're a little ahead of schedule, which is unheard of for us. But if you would like to jump in, we could move ahead early.
I think we should be ready. We have everyone on. I think, Becky, you're running the slides. Awesome. Okay.
Yeah,
well,
just
I'll
popping them up. Can you see the
yeah.
proper screen? Okay, great.
Yep, they're there. Thank you. Well, great. Well, like I said, thanks for having us back again. We had the privilege of talking to you before about some of the earlier work that we've done on education outcomes and youth with foster care experience. We had the opportunity to look more closely, specifically at school mobility and youth with foster care. And so that's what we're bringing to you today. We're going to start, actually, why don't we go ahead and go to the overview. Yeah, thank you. I'm going to give you a really high level intro again. I know there may be folks here that haven't heard of what OKID is, and always happy to answer questions, but I'm going to be very brief in my introductions. Or my overview, and then I'm going to turn it over to Dylan and Amelia, who are going to talk to you about the student mobility analysis that we did with a specific deeper dive into foster care. And so, and then we have some discussion questions, which Becky will lead. And really for all of OKID, like our goal is to share with you what we've seen so far in the data and get your reactions and questions. And even if you don't have like fully formed questions, how you reacted to the data tells us a lot about what's useful, what's not, where we could maybe go next. And then we turn around and work with our governance committee to figure out where to go next. So that's what we have planned for you. So why don't we go ahead and get started, unless there's any other questions or anything anybody wants to flag before we dive in. Okay, I'm going to jump in and definitely jump in with any questions while we're talking. We always find that actually answering questions at the time of the slide really helps everybody sort of orient to the data, and we know everybody ingests data differently, so do not hesitate to sort of pause and say, do you mean X? And then we can have that discussion. So just really in a nutshell, just to remind you what OKID is. OKID is a very large data set that as we are now in our third biennium of, we feel like we've gotten beyond startup, and we're now rolling in a way that we're pleased with the progress that we've made. But really making a lot of that progress has been making contacts with folks like yourselves. It was created as a nonpartisan resource to support policymakers. And so what's contained in OKID is a whole range of data, which my second slide will go to in a minute, is outlines all the data sets that we currently have in OKID. But it has a range of data sets across what you typically would call policy silos and programs, agencies, integrates it at a child level, but then allows us to look at it at a population level. We don't do anything specific to service delivery or really focusing in on individual kids. It's about using that cross-program data to be able to understand the trajectory of kids over time and how they're interacting across what typically are kind of program silos. And with the ideal, if we land on the secret sauce or figure out the secret sauce, ideally we are providing data that allow all of you in the policymaking community and our leaders sort of, just think about where efforts should be targeted. And so it's not an end all be all. We can't answer a lot of things. We can't do anything about lived experience necessarily, but we're one sort of arrow in the quiver, one tool in the toolbox to help with these conversations. So we do have data across the programs I'm going to show you in a second, but we also have it, if it's available, starting in 2001. So it's a pretty significant sort of cross-section in different ways of Oregon's children. And just one comment I'd make on the governance of this, we're at the Center for Evidence-Based Policy, which is at OHSU. So the project itself is overseen by the Institutional Review Board there at OHSU, but also then we have a governance committee that includes, actually Rachel, who's on the call, sits on our governance committee. So we have someone from the governor's office, we have legislators, both houses, both sides of the aisle, and leaders from all the agencies that provide us the data. And so they're really charged with helping us prioritize what sometimes feels like boiling the ocean. So so that's sort of how we roll as a project. And let's go ahead and go to the second slide, Becky, or the next slide. Thank you. So this gives you a sense of the data we have, and just kind of going around sort of counterclockwise there. We have income maintenance as well as child welfare from DHS. We have allegations and placements from Oregon Youth Authority and the county juvenile justice system. From the Health Authority, we have the birth and death records, and that allows us to look from maternal or birth characteristics all the way through these other programs, if that's something that's valued for an analysis. We also have Medicaid claims and enrollment, and talking about sort of if there's a possibility to expand to the all payer at some point. And then we have home visiting, both at OHA and from DELC, Early Learning and Care. We have Head Start, we have employment related daycare, and then you can, swinging around to the right, you can see that we have a lot of data from the Department of Education in terms of assessments and attendance data and IEP data, 504. We also have EIECSE program participation data, and we do get the McKinney-Vento student houselessness data as well. So that's sort of like in a nutshell. It's a lot of data and it's a lot of need to focus, but that's what we've been doing. Actually, speaking of focus, if we want to go ahead and go to my last slide, and then I can turn you over to the team to talk about the work we've been doing. You're going to be hearing about, this is our essentially our research plan for the next year or so. We've been working on student mobility. We're sort of wrapping this up and getting input on the work we've done. We are on the verge, I think it's going to be early fall. We're going to be releasing data on children with complex social and medical needs. And that will be of interest, and we're happy to bring it back to you. We've also been reaching out with the system of care folks who actually will be sitting with our governance committee going forward, their director. And then we are just now formulating what we are going to do around youth with behavioral health needs. And so that is very formative. So if anybody wants to talk to us about that, we would love to get input, because we could go a number of different directions. That's likely to be very descriptive to start with, so we can see where people have, strong questions, follow-up reactions before we kind of dive into really refined research questions. So that's where OKID is right now. Any questions about OKID before I hand you over to the team?
I have a quick question.
Uh-huh.
I know that the students in foster care were kind of a focus around this student mobility. Will children in foster care be called out in the other analysis you'll be doing?
Yeah, to one extent or another. And I think that's, we do have some foster care specific data when it comes to the complex social and medical needs. I think it's a little unclear what will end up in an actual brief, but that's something that I think we could reach out to you and sort of talk about what we have at that point. It's been a lot. Essentially, we have a lot in that category at this point, and so we even had to kind of rejigger kind of how we're even releasing the documents because we realized we had way more than that could go in one document. So foster care is sort of sitting there as well as something that we could do a call out on. So happy to get input on that or talk to you about it. And then definitely with youth and behavioral health needs, we will try to figure out some way that you can that the foster care population can be highlighted. One of the other things I didn't mention that we do reports, but then we've also been trying to build our ability to do online data interactives. And I think if any of you sat through the workshop, attended the workshop with Becky and others, she would have shown you some of those online interactives. And that tends to be a place where we can, maybe if a document doesn't focus on a particular population, we can provide the data in an interactive for you to be able to select foster care. So that's a long answer to your question, but we know it is a priority. So,
Gretchen, I have one more.
Sure.
All of these are really valid projects. Once you have the model in place and you have a way to collect them, are you going to keep collecting the data as time goes on?
Yeah, the data is refreshed annually, completely refreshed annually. So we've had now I don't know, Dylan would know this off the top of his head. I think we've refreshed it 4 times now or 5. And so we do get, everything you just saw on that slide. We work across all 5 agencies with like 8 or 9 data use agreements and everything, and to keep updating it every year. So right now our data use agreements go out to 2028, I think. And then, and we just extended those a little while ago. So that's one of, trying to build this project in as something that is an ongoing tool and resource is one of our objectives.
Hey, I would just throw out there, in case this is part of what you were wondering, this is Becky Griffin. That is the case for our data. In general, when it comes to a specific analysis, if that's what you mean, we won't necessarily, they're based on a cohort that's identified at the time of an analysis. And that cohort wouldn't necessarily be expanded to future, say it was a high school graduating class, we might not do that same exact analysis on, whatever the following high school graduating class is. That's something that would sort of be decided, I think, based on ongoing interest and the need to expand that cohort to identify trends, I guess, in future, populations.
So we wouldn't be able to get student mobility data for next year's class then?
I think what we would want to hear from you all, if it is valuable for you to be able to access certain data going forward, we can incorporate that into our considerations of balancing sort of all the other requests we're getting. And that's where things like the interactives come in handy, if because they're a little bit more dynamic. Well, by nature, they're more dynamic than a report. And then also the other thing that we are just sort of scraping the surface on, just to mention it, because I think it really goes with your question, is that we have a dashboard right now that's up on the website that has a range of indicators. It was our first thing we did out of the gate 5 years ago. Foster care is an indicator on that, and I'm happy to show that to you. I think Becky might have hit on that in the workshop. That hadn't been updated every year, and we're pivoting right now to decide how we can do that better, because we've not received a huge amount of input. We're not sure if it's being used in its current form. And so there's an intention there of, if there is data that's regularly being used and people get to know, like, oh, OKID publishes that data, that will heavily sort of affect what we do going forward, because we don't want, the whole goal is to make this as, valuable as possible for all of you. So feedback is great. Any way you want to give it to us. And there's web emails at the end of this presentation too, that you'll get this full presentation. So, okay, cool, great questions. Anything else? Okay, I think I am handing you over to Dylan now, right, Dylan?
Yes, you are. Thank you very much, Gretchen. And thank you all for having us today. As Gretchen mentioned, I'll be kind of giving a high-level overview of our analysis on student mobility within the general student population. And then following that, I will hand it over to Amelia to talk a little bit more about student mobility among youth in foster care specifically. Next slide, please, Becky. So to start, we kind of wanted to give you an idea of the types of questions we were aiming to answer with this analysis, with these two analyses, I guess. So this kind of gives you an outline of the types of information we'll be presenting today. So within the broader kind of mobility analysis within that general student population that I'll be discussing, we were most interested in understanding which types of student mobility have the strongest impact on high school graduation. We were interested in understanding if specific characteristics like the number of transitions a student experience affect their chances of graduating. And then this last one is really trying to get at sort of measured of severity or magnitude of change, where we're thinking about, do transitions occurring within the same school district have the same effect on graduation as transitions outside of a school district, which might represent sort of a larger change. Within the mobility and foster care analysis, you'll see a lot of the methods kind of continued through that. So the definitions of everything are the same. But within that analysis, we were really interested in understanding how children with foster care involvement experience student mobility and really how that differs than what we saw within the general student population. And then kind of furthermore understanding what the impact of that mobility among youth in foster care was on graduation rates. So it's kind of an outline of what we'll go through. But just to give you an idea there, the next slide here really gives you a little bit more background as to maybe why we were interested in student mobility. And I would say largely the work that we are presenting to you today really aims to build on findings from previous OCID analyses, and I would even include ODE analyses within that as well. So in 2018, ODE released a research brief on student mobility. Then following a year or two later, OCID, we kind of replicated that analysis and found very similar findings that youth that were experiencing a mid-year transition had 30 to 40 percentage point lower graduation rates, which we thought was sort of an interesting area for us to dig a little bit more into, which I think is really what we try to do with this analysis. So within the analysis that we're presenting today, we did expand our study cohort to include 2 ninth grade cohorts, which I'll give you a little bit more information on the next slide. We did look at high school graduation in 4 or 5 years, but would note that we do not currently have the data necessary to include attainment of a GED. So we would recognize that as a limitation, I think, particularly when we talk about the foster care population. We did look at greater detail, or tried to provide greater detail on the types of mobility students experience. We did do some statistical analysis. And then maybe most importantly of all these bullets, just a point of clarification, we did exclude transitions due to natural grade promotion. So when a youth moves from elementary to middle school or middle school to high school, we are not including that as a transition within this analysis. Last thing I'll say on this slide, and I think it is important for us to note, is that the results that we go through today really don't indicate that student mobility alone is the cause of those lower graduation rates. And really some of the results we may see may be due to other disruptions in the youth's life. So I think one of the challenges that we had within this analysis was within the data we have, and I think maybe more broadly within the data collected by state agencies, is understanding the reason a transition occurs. And without kind of that information, a youth may be moving to access services that aren't available in their district, or they may be moving as a result of housing or financial instability. And without that reason for it, it is kind of difficult to disentangle the effects that we're seeing. So within our statistical analysis, we did our best to adjust for confounding factors, but do want to caution against interpreting these as causal results. And then would just recognize that further research will really be needed to identify the root causes of school transitions that we identify here. Next slide, please, Becky. A little bit of background on the population that we're looking at it. So as I mentioned, if we start here in the top left box, that is kind of our general student population. So you can see we had approximately 90,000 students across those 2 years. And those consist of first-time ninth graders in the 2016-2017 or 2017-2018 school years. So We're looking at those school years because we need graduation results for 5 years, and our data kind of maxes out at 2022 right now. So that's why we picked those years. Following the arrows, you can see our second box there is really looking at youth that participated in foster care, which we identified as being approximately 5,000 of those 90,000 students. So those are youth that ever entered the custody of ODHS and had at least one foster care episode. And then if you continue to follow those arrows, the last box you'll see here will really be the focus of some of the results that you see in regards to the foster care population. And that is really youth that experienced foster care during school age. Or in other words, youth that experienced at least one foster care episode during or after their enrollment in Oregon public schools. So of those 5,000 or so youth that ever experienced foster care, we saw that about 2/3 of those, or about 3,000 youth, experienced it during their enrollment in ODE in Oregon public schools. Next slide, please, Becky. So a few definition slides just to make sure we're all on the same page. The first kind of listed definitions we have here are regards to our types of student mobility. So like I said, these are consistent both for our general student population, and then you'll see these same types within the foster care analysis that Amelia goes through. But within our types of mobility, we have within district transitions, transitions that occur between two schools in the same school district. We have outside of district transitions, which are transitions that occur between two schools in different school districts. We have late enrollment, which is enrollment in Oregon public schools for the first time after first grade. So within the data we do have students born outside of the state of Oregon, and sometimes we see that they enter school late, and we wanted to identify that. I think we lost our slides. There we go. And then enrollment gap is our last category of student mobility. So that is when a student is unenrolled from Oregon public schools for at least one academic year and then returns to Oregon public schools. I will just note on that one, the data we have within OCID is restricted to Oregon public schools, which is why we require them to return to a public school. We do not have information on private schools, unfortunately. And then the last little box here that you'll see is that all 4 of these types of mobility can either occur during the midyear, which we define as mid-year transitions. So those are the ones occurring during the academic year from September 1st to June 15th. And they can also occur over the summer or outside of the academic year, which is from June 16th to August 31st. And then a next little bit of definitions that we just want to make sure everyone is clear on before we start talking about them. These are related to foster care and how we define different foster care events. Many of these, I imagine you have some familiarity with. But just to make sure we're kind of talking about the same things, within this analysis, we defined foster care participation as youth who entered the custody of ODHS and had at least one foster care episode or removal. And then if we look at our foster care specific events here, I'll really just focus on foster care removal and foster care placement, but we do have a few others there at the bottom. A foster care removal, we defined as a child being taken from their home and placed in the custody and care of ODHS. Importantly, we do want to note that this does not include children in ODHS custody who remained in their home. Some of the feedback we've received since conducting this analysis was that Oregon is maybe trying to expand that definition to include youth who remain in their home to make sure that they have access to the same services. And while we certainly support that, we do want to note that that is not a part of this analysis. So we are really looking at out-of-home placements within this analysis. And then the last definition I'll read here is in regards to foster care placement. And that's just the physical setting in which a child resides after a removal. We do just want to note that a child may experience multiple placements per foster care removal, which will provide some clarity or give you a little bit more information when Amelia talks about that within her portion. Next slide, please, Becky. So I don't have any slides, any figures, excuse me. We'll have to wait for Amelia to get to those, but we did want to give you an idea of some of the high level takeaways that we saw within the general student population. So to quickly go through those, we did see that student mobility was a common experience even within the general student population. We saw that almost 3/4 of students experienced at least one school transition in their K through 12 education, so across kind of their educational career. We did see that mid-year transitions occurred more often than summer transitions and also had a stronger negative association with high school graduation. We saw that students who experienced more transitions were less likely to graduate from high school. We saw that students who experienced a transition outside of their school district were less likely to graduate than those who transitioned within their school district. So a slight indication that the magnitude of change might be a factor there. And then the last point here, I'll actually talk about a little bit more on the last slide, but we also did see some student groups experienced mobility at disproportionate rates, which is something we are very interested in within kind of the OKID project. So before can you actually go back to that last slide, Becky? Before I move on and move to that slide about disproportionate rates, does anybody have any questions about, I guess, the approach we took to this analysis? Sounds good. Then I know we're kind of waiting for that foster care specific information, so I will not hold us up anymore. Becky, can you go to the next slide? So one of the things that we just wanted to kind of emphasize and maybe give you a little bit of background for as to why we looked at foster care in particular was within OKID, we are definitely interested in looking across equity characteristics. So trying to understand if there are groups of students that experience disproportionate rates of, in this case, mobility, but across our analyses, it might be a variety of outcomes. And then we are also very interested in cross-program participation. So for youth that experience mobility, what other programs within the state are they touching? So I won't touch on all these factors. I just want to say that that is something we do within each of our analyses within OKID. And then would point, if we look at the program participation bucket, which is the bottom half of that figure, you can see that foster care was one of those programs that we identified as having students who experience higher than expected rates of mobility. So the statistic here is 91% of youth with foster care that had ever been in foster care. So they weren't necessarily currently enrolled, but 91% of those youth had experienced at least one school transition at some point in their educational career. And that is much higher than the 72% we saw within kind of the general student population. So that was, not only is it kind of an interest, I think, across the state right now, but even within our data, we were seeing some interesting points that we wanted to explore a little bit further. So that is all I have for you, and I will turn it over to Amelia to talk a little bit more specifically about youth in foster care.
Thank you, Dylan. I apologize in advance for my voice. I'm recovering from a cold, so hopefully you can hear and understand me okay. But like Dylan mentioned, we produced a second student mobility brief that focuses specifically on youth who participated in foster care. So I will go over those findings now. So in the brief, we compare several equity characteristics between those who were ever in foster care compared with those who were never in foster care. And as you can see in this figure, foster care youth were more likely to be enrolled in and to interact with other public programs, which highlights the cross-program opportunities to provide support to this population. So for example, 57% of youth who ever had a foster care episode also had juvenile justice contact, compared with 11% of those with no foster care experience. Foster care youth were also much more likely than their peers to be enrolled in TANF, have an IEP, have a mental health or substance use disorder diagnosis, experience houselessness, and experience school discipline or severe chronic absenteeism. And we talk more about this in the brief, but foster care youth were also more likely than youth who weren't in foster care to identify as American Indian or Alaskan Native, Black or African American, or Hispanic, and also more likely to live in rural or urban areas. And for context on that, we use the geographic categories rural, urban, and tri-county in our analyses. Next slide. So in this analysis, we found that 94% of foster youth experienced student mobility at some point during their K through 12 education. So this is an extremely common experience for this population. And in this figure, you can see mid-year transitions in blue on the left and summer transitions in orange on the right. And the dark blue and dark orange represent foster youth, and then the lighter blue and lighter orange represent non-foster youth. So you can see that compared with their peers, foster youth were more likely to experience all types of school transitions, except for late enrollment into Oregon public schools. And it's particularly notable that foster youth were more than twice as likely to experience outside district transitions, which is represented by the bars at the top. And they had on average 4.5 times more of these transitions than their peers. Next slide. Foster youth experienced high mobility throughout their educational experience, including both during foster care episodes and outside of foster care episodes. So about 70% of the school transitions that foster youth experienced actually occurred outside of a foster care episode, while the remaining 30% occurred during a foster care episode. But for context on this, on average, foster youth spend about 2.5 years of their K through 12 education in foster care. So that means that there's a lot more time outside of foster care episodes for these youth to experience mobility than during that roughly 2.5 year period while they're in foster care. So it does make sense, just given the length of time spent in foster care versus outside of foster care, that more transitions would occur outside of foster care episodes. And for transitions that occurred outside of foster, oh, go ahead.
I mean, do you count the initial return to home after they've been in foster care as a transition that's during or a transition that's outside?
I will let Dylan answer that one just to make sure he's getting it right, and he would know more about that than me.
I would say the data we have really just is that initial entry date. So I would imagine we aren't including that transition, so we're really only looking at the school transitions, but that time period would be included in the during kind of section.
Yeah, I would just add just to clarify.
Are we not counting? I'm sorry, are we not counting the moves from foster home to foster home?
Within here, transitions, we're really only looking at between schools. So it's not looking at different placement settings. It's really looking at just related to school enrollment, whether they were in a different school. That's kind of the transition we're looking at, if that makes sense. So it's only educational transitions. It's not welfare related transitions.
I guess just to follow up, I mean, there are a lot of times where they will move from school to school because they move from foster home to foster home. Would this capture that?
Correct. Those would be included. Exactly. Those would be included here. Yeah. I misinterpreted your question. I apologize.
Thanks. And sorry for the interruption.
No problem at all. Okay, so then looking at the transitions that occurred outside of a foster care episode, so the bar on the bottom, we broke this down even further to look at before the first removal, between foster care episodes, and then after the last foster care discharge. So about 35% of school transitions occurred before the first foster care removal, 12% occurred between foster care episodes, and 53% occurred after the last foster care discharge. And again, just because of timing, it does make sense that most of these transitions occurred after the last discharge, because the average age of first removal was 8 years old and the average age of last discharge was 12 years old. So this means that the majority of students had more years of school after their final discharge than before their first removal, which can help to explain why there were more transitions happening during that time. Next slide. The graduation rate for foster youth who did not experience mobility was 77%, which is actually pretty similar to the graduation rate for the overall cohort of students, which is 80%. Whereas you can clearly see that the graduation rate for foster youth who did experience mobility was much lower at 55%. I do want to note that only 6% of foster youth did not experience mobility. So this bar in the middle with the graduation rate of 77% is a pretty small portion of foster youth and is not a common experience. Next slide. One key finding that we had is that graduation rates varied more by the number of school transitions than by the number of foster care placements. So I will walk you through this figure and what this means. So in this figure, the rows represent the number of school transitions, and they're grouped into 1 to 2 transitions, 3 to 4 transitions, 5 to 6, and 7 or more. And then the columns in the figure represent the number of foster care placements. So we have 1 placement, 2, 3, or 4 or more placements. If you follow any of these rows across, you can see that the graduation rates don't actually change much as the number of foster care placements increases. So for example, the graduation rate, if we look at just this top bar, the graduation rate for youth with 1 placement and 1 or 2 transitions is 68%, which is about the same as for youth with 4 or more placements and 1 or 2 transitions, which had a graduation rate of 69%. However, graduation rates were lower among youth who experienced more school transitions, regardless of the number of foster care placements they had. So for example, the graduation rate for youth with just 1 placement, but 7 or more school transitions was 43%, whereas the graduation rate for youth who had 4 or more placements, but only 1 to 2 transitions, was much higher at 69%. So therefore, the number of school transitions a student experiences appears to be more closely tied to graduation rates than the number of foster care placements they had. And this probably also explains what we saw in the previous slide, that foster youth who didn't experience any mobility had graduation rates that were similar to the overall student population. And I just want to point out one more thing on this slide. So of foster care youth who experienced mobility, the group with 4 or more placements and 7 or more school transitions was the largest, with 450 students, and that's the bar on the bottom right. And they also had the lowest graduation rate at 35%. So both high mobility and having a high number of placements are common experiences in this population. And those with high mobility in particular tend to have lower graduation rates. Next slide. So some high-level takeaways from everything I just went over are that youth with foster care participation experience higher rates of mobility than the general student population, and these youth had particularly high rates of outside district and mid-year transitions. Foster care youth experienced high mobility throughout their educational experience, regardless of the number of foster care placements they had. Which indicates that there are other factors driving the high student mobility rates among this population than the foster care experience alone. So for example, family instability, juvenile justice involvement, school discipline, deep poverty, things like that, all of which are relatively common experiences for this population. Our analyses also showed that 70% of transitions occurred outside of a foster care episode, whereas 30% occurred during a foster care episode, which again may be explained by the fact that foster care youth spend only about 2.5 years total in foster care. So there's a much longer time period outside of foster care. Graduation rates varied more by the number of school transitions than by the number of placements. When the number of school transitions was equal, youth with 1 placement had similar graduation rates to youth with 4 or more placements. And then lastly, foster care youth are a highly complex population, and it's difficult to disentangle the effects of foster care involvement from the effects of other layered experiences and characteristics that are common within this population. So efforts to reduce mobility among this population should consider the complexity of foster care youth and should aim to address the root causes of mobility, including poverty and housing instability. Next slide. Okay, so I will turn it over to Becky to lead some discussion.
Thank you, Amelia. Yes, I will take over for our wonderful policy analyst so she can rest her voice. And first of all, before we dive into any specific questions, I would love to just give everybody an opportunity to ask any questions you have about the findings to our team, and maybe share any surprises or reactions to those findings with us.
Hi, this is Casey. I would say that what was really surprising to me was that that the transitions had so much more of an effect than the placements. I don't think I would have expected that. One question that brought up to me that, you know, I don't know if you'd be able to answer is a lot of what we do, or a lot of what I've been seeing through this lens is looking at things we can do with DHS. And but I wonder what the schools do for people coming with transitions. And, you know, obviously one of our focuses is how do we minimize transitions? How do we minimize placements? But another question we could be asking is what can the schools be doing for the people that are having these amount of transitions to alleviate that?
Thank you, Casey. And I will definitely open that up to everybody here that might have any insights into that question. It's a question that I also had for you as a collective group, was what your awareness was around any policies for tracking or responding to youth who are experiencing a higher number or a minimum number of school transitions.
There's a comment in the chat from Carissa. It says, I'm interested to see how things go with the pilot sites for HB 4084.
Is that the student navigator, the foster care navigator pilot?
I believe so. I think there's 4 or 5 different schools that are going to be, middle schools that are going to be doing that. So I'm interested to see if will you be able to pull the data out of those schools to see if that has an impact.
Good point.
Will the OCID team be able to?
Yes.
I'm going to let Dylan respond to that question.
We do have information on individual school attendance, so we would potentially have some data that would allow us to explore it. I don't know if we'll have everything we need to really dig into that question. And in general, I would also say we try not to do program evaluation. So I think that starts to toe a line that gets maybe a little bit challenging for us to do, but we will have data that applies to that question, and it is something we could explore in the future. Absolutely.
Yeah, and if I could jump in, this is Gretchen too. Thank you, Dylan. That was great. One of the things that we're actively balancing as we think about our analysis going forward is thinking about getting sub-state and what's the right way to do that with the data that we have, and that kind of stems across all of our various areas of interest. And so we just need to be able to balance kind of keeping the conversation at a higher level versus sort of very specific evaluation, like Dylan was saying, which does require, you know, sort of much more of a research paradigm to make sure that you're controlling for all the right factors and stuff. So I wouldn't be surprised if this is a question that gets lobbed back to us at some point. And, you know, just you asking the question allows us to keep just plowing that into our ongoing kind of, you know, how do we do, you know, things below the state level, particularly when there's an actual, you know, change in policy like you've highlighted. So we can keep thinking about that.
Any other questions, reactions? Oh, great, Pamela.
Yeah, when I was looking at the data, one thing I wanted to see is, okay, let's rewind, and for those youth who have the lowest graduation rate because they have the most transitions, if you pulled that subset out and then filtered across the juvenile justice involvement, the behavioral health system involvement, I just wonder where they show up on that. Because if you are looking at kids over 12, you're looking at kids, you know, that middle school to high school, which is so hard. And I just wonder if those youth are getting caught in some of those other systems with other issues. And that's what needs to be addressed rather than, you know, anything really to do with the foster care experience.
That is a great question, Pamela, and we've had similar discussions among our team about sort of now that we have this subpopulation, are there specific outcomes that we're seeing within that subpopulation that would warrant a closer look at some of these subgroups. That was one of the groups that we had identified, was that large percentage of youth who did have the high number of transitions, which corresponded with a lower graduation rate. And then the other group that we were interested in was that smaller subset of youth who seemed to have a lower number of school transitions, which correlated with that higher graduation rate, to see if we could find any trends within both of those groups. And Dylan, do you want to add anything else, about Pamela's question?
I don't have anything to add at the moment. I thought that was a great summary, Becky.
I see Carissa has a hand up too.
Sorry, Ed. Can this data be broken down regionally so we will know which school districts or which geographic areas would have the highest transitions?
That's a great question also, Carissa, and I think it kind of goes along with what Gretchen was just speaking to, which is that we do have a desire to start looking on a more granular level at some of these outcomes when we do future analyses, and are kind of trying to determine what lens geographically is going to be most useful to assist in policy discussions, whether that's looking at a school district level or maybe something slightly larger, looking around education service districts. Or are there other trends that we're seeing that kind of help to differentiate different kinds of rurality versus urban experience that we might be able to map to? At this point, sorry, go ahead, Gretchen.
Oh, I was just going to say, it's also it'd be really interesting to look at this compared to the children's health complexity data and see what those things look like side by side geographically.
Absolutely. Yes.
Yes, and we are parking away all of this input, and like I said, the complexity work is coming out, and this question of people being able to see, at least at their community level, I like what you just said there about being able to put a couple of these indicators next to each other. We will be synthesizing your input, because it's we appreciate knowing that other people are asking the exact same questions we're thinking, and so really good.
I think we have a few more questions in the chat, Becky.
Oh, okay.
Malik asked, is there a way to collect mobility based on types of foster care placements, therapeutic, kin, even residential? And I can speak a little bit to that, I guess. And then Becky, if you wanted to say anything, you could. We do have data on the type of placement. I will say we are currently relying on AFCAR's data for our foster care information. And as many of you know, I'm sure that the data collected through AFCARS, through that federal reporting system, is changing currently. So the historical data we have doesn't actually have information on every single placement. We just kind of get those rolled up reporting periods. But moving forward with the AFCARS 2020 data, we should have information on all placements, which would make something like sorting by type of placement or a little bit easier. So future analyses, we hope to incorporate that level of detail. I think it's a little bit challenging with the data we have right now.
Yeah, and it's going to take some time before there's a cohort of youth that will have that data available, because the new AFCARS data will not go back retroactively and incorporate that data for past years. So right now, a lot of placements that are going in between, during a reporting period will not include the placement type. So we wouldn't be able to do that for every placement.
Thank you.
Thank you, Alicia.
There's another
question. If she's gone already, I can't tell.
Okay, and then it looks like a couple of comments based on that. Okay. So Adam's question kind of spoke to this already a little bit, but we are also wondering if these findings lend any insights or reinforce your understanding of how to improve educational outcomes for youth involved in the child welfare system. I feel like I said Adam, I meant Casey, sorry. I feel like Casey's comment spoke to, you know, one potential avenue of being able to learn more about what's being done in schools to monitor transitions and the number of transitions. Are there any other thoughts that are kind of percolating as a group, or does this reinforce anything that you already have in your recommendations?
I mean, I feel like it brings up a new recommendation around who is paying attention with the youth are moving school districts, and is there really anything done besides thanks for enrolling, here's your classroom and your schedule, to track down where they came from, what the cause was for the move was it work related or some other issue? And I don't know, I don't know off the top of my head any particular program that looks at that. But, you know, like one of our recommendations for, what was it? Like on the third move, there should be a placement change in foster care. There's an alarm that goes off and you go look into it and see, why is this youth moving? Maybe youth is jumping around school districts. There should be an alarm bell that goes off that says, you know, school district or Department of Ed, you know, take a look at this population of youth and see what's going on. Maybe they've returned home from foster care and they're, you know, safe statutorily, not being abused, but maybe their life is very still unstable. And there's something else that family needs to stabilize and keep kids in a, you know, consistent school. So yeah, I don't know. That's what comes to mind for me.
Yeah, and to jump in there, Pamela, one of the things I'd also pull out, and team, you correct me if I'm saying anything wrong here, but I think, you know, we obviously want to present the findings in a clear way that show that it might make sense why the transitions are happening both before and after and in between, based on just the sort of those average number of years that our kids are in foster care. With that said, overall, the transitions for this population are considerably higher, right, team? I mean, overall. So there's clearly and I think that's one of the things, we want to make sure the findings are being, you know, conveyed accurately, but also that to your point on who's following or who's looking at these kids, you know, that if they're transitioning a lot already, so that if they're coming from, you know, families that might have some stability concerns and for different reasons, you know, that's before they're even hitting the child welfare system. And then afterwards, you know, is there follow-up as well? So it kind of expands on your question of sort of, you know, what's the system that could be out there to support these kids across their development. And team, jump in if I did anything that skews the explanation of the data.
No, that's just right. And I think we did just want to emphasize that even though we are seeing a lot of mobility outside of foster care episodes, we do have, you know, at least a partial explanation for that based on how much time these youth are spending outside of foster care. But I would also point out that youth during foster care episodes are also experiencing a high level of mobility, especially when you consider the brevity of that within their full life course. Our study found that 24% of foster youth experienced a transition within 1 month after a foster care removal, and that 50% experienced a transition by a year after removal. So we're also seeing a lot of transitions taking place during foster care episodes. It's more just that these youth are just highly mobile throughout their student experiences, both inside and outside. Mm-hmm.
Yeah, and we've passed policies to stabilize youth moving districts. You have to have special circumstances now and prove to the court that why the youth is needing to move districts. You have to, the school is supposed to pay for transportation to the original district if they need to. I feel like we've cobbled together things to try to improve school stability. But this sounds like there's a bigger problem than that there's instability even outside of the, you know, stint in foster care that maybe needs to be addressed, in addition to obviously continuing to look at how kids in foster care can maintain their school districts.
Yeah, and I feel like you're pointing to an intervention that does reach beyond the, you know, DHS system to capture these students throughout their life course. And it's the exact same parallel that I saw when I looked at your recommendations and how you have that recommendation to have a system in place around placement changes. And so, yeah, that's well observed.
One of the things that, I mean, I was surprised, like Casey was, that the school transition seemed to have more of an impact than the placement transitions. I think that this would be really valuable data to keep collecting, because oftentimes judges are confronted with that problem when they have a hearing of, well, if I move the child, they're going to end up with the school transition usually. Sometimes it should be a question, or at least judges should be armed with that fact that might have more of an impact than a placement transition. I just wouldn't have thought that either, and would always choose having them have sort of family stability rather than school stability, but it sounds like maybe that's going to have a greater impact. So it should be something that we at least have data on, that we can see if that stays a trend over time or if this is just an aberration.
Absolutely. So well said. And my background is in foster care, particularly foster care advocacy. And that is out of, one of two findings out of this whole analysis that really jumped off the page to me. I figured both would have a high impact, but the fact that there was just such a huge drop in graduation rates based on transition as compared with placement was striking to me, really was. Which is why I had that as a question for you, which you just, answered, was I was really curious what reactions the rest of you would have to that finding of transitions having such a large impact as compared to placement changes. Was that, what about for any of the rest of you?
Oh yeah, I totally would have never guessed that. Yeah, that's pretty shocking.
Yeah, and so it would, we are definitely noting that it would be nice to see over time if that is a continued finding. And then we've already talked about this quite a bit too, but that this last question kind of already naturally wrapped into our discussion, thinking about the fact that the mobility for these students takes place both during and outside of foster care episodes. So maybe I'll just jump to this last question, unless anybody has anything else they wanted to talk about on that. But we would love to know, based on this or just based on the work that you're doing, if there is additional research that could shed more light on the educational needs of youth involved in the child welfare system. And I'll just say one thing that I took from your recommendations was the desire to expand at least the educational protections, the definition of foster care to be looking at youth who remain in the home. And so I've definitely already made a note of that. And I think it's a good question for us to review with agency partners as far as how we might have access to a look at the experiences of those students. Right now, the data that we have is limited to students or youth who experience a removal. But love to hear anything else that you have in mind.
What information would you need to be able to collect the impact of funding transportation for kids who are in DHS custody but in the home and have to move with their parents because the home that they're in is substandard? I mean, how would you collect that data, and what would you need us to monitor to be able to do that?
Because they right now wouldn't qualify under McKinney-Vento for the transportation services.
Right.
Mm-hmm. That's a great question. Well, I guess the first thing we would need would be and I'll leave the rest of this to Dylan, but we would need a flag to be able to identify those youth within the, if we were looking at, say, the population of youth who enter into Portland Public Schools, we would need to be able to identify the youth that fell under that category.
I'll just follow up, Becky. I totally agree. I think one of the things that we struggle a little bit with within OKID is receipt of specific services. So we often have kind of a higher level flag that indicates they participated in X or Y program, but we don't usually have information on the specific services they received. So I would say maybe more detailed information on, not only was the youth attending a school where this service was available, but then really that data that links them to actually receiving that service, I think would really be helpful. So a lot of what we receive is kind of rather high level administrative data and doesn't always let us get to the specific details like that.
That's good to know. One thing that I would love to see is this population who had the greater transitions and greater placement changes, almost like pull that group out and redo all the analysis. Did that group have more the absenteeism? Did they have the more like all the other data that you ran where we have all the averages in your this presentation, but just do it on that slice? And I would be curious, were they at a higher age when they left foster care? Did they actually spend more years on average than the bigger population of foster kids? Were they looking at a 4-year foster care stint rather than 2.5? So I would be really curious on digging deeper into that, a snapshot of that population, because that might tell us something too. Love that. And then looks like Rachel and Seema have their hands up. Go ahead, Rachel.
Hi, thank you, everyone. I'm really glad that we're having this discussion with the commissioners here. I'm just reflecting and thinking about when we started this discussion where we had a member, I forget the doctor's name, from Ben Linton Lane, who was working on a health home for talking about the challenges with transitions for stability, with getting your well child visits and getting all of your health benefits. And, I'm just observing that we're having that same discussion, right? As we're talking about the need for stability and the transitions when we think about for school. And I think at least where I'm struck, just being curious and would want to think about this more and get advice from all of you before we would make big changes. But just observing, we're really talking about what's in the best interests of the child and when we're making decisions, and when is it that we've really made sure that kin and stability for placements, making sure that children are remaining with family, and then also just seeing that trend impact on potential health and education outcomes, and just that makes me I'm just curious about that. I want to understand that with all of you. Are we potentially making recommendations for placement that are not in the best interest of some of the children at times, is perhaps what this is indicating. And I just want to assess, is that your reaction as well? I'm curious.
Yeah, I mean, that's a hard one to say out loud, right? Because so much effort and so many years and so much time and so much policy change has gone into that. And it is worrisome to see that it might actually not be leading to the outcomes we want.
And I just want to note, I do think it's important that, we really think and use an evidence-based perspective and research to make sure that we're not making jumping to conclusions, that we're digging in, that we're really understanding each individual case. And I guess that's where I'd want to understand from OKID and others, what other research would we need to be really thinking about to help us understand impacts of intended policy impacts, and are they having the outcomes that we're anticipating before we would just make changes that could have unintended consequences.
It's such an important point, and the reason why I think it's so important for us to again point to the fact that we're not looking at causality here, and we are looking at a larger cohort than we did with our foundational analysis, but it's still one cohort of youth and their experience. There was something else that I really wanted to speak to on your point, and it just flew out of my head. But I see, Gretchen, you also went off mute. Go ahead, and then I'll jump back in because I do have an important point. I just forgot what it was.
Oh, no. And I just actually was just thinking that, to me, the question was popping to mind that I didn't want to put my team on the spot for, so you guys don't need to feel like you have to answer, but it's the question of disentangling the outcomes for kids who are experiencing mobility during the foster care period versus sort of all those other transitions that are happening before and after or in between foster care. And it's just an example of what you're saying, Rachel, in terms of, what is the disentangling that needs to happen, before, because it could just be that these kids throughout their entire development are extremely mobile. And so, it's sort of like drawing that causation just to like what the foster care system's doing is probably not, the data is probably not completely there to be able to do that. So anyway, that's what I should say. That was my thought, Becky. Did that help you think of yours?
Yes, it did.
I don't know how. Oh, my bad.
Oh, it's okay. Just to wrap up what I was saying was that we're also just looking at one outcome here. So it's a very important outcome, but that's not to say that the instability of multiple placement changes doesn't impact youth in all different other ways. And so just bearing that in mind was all I was going to say.
Yeah, totally.
It looks like, Becky, you have a question from Casey, and then I wanted to do a time check with Ellen.
So I was just going to comment that, in court, when we do the placement change, that oftentimes is contested, but the school placement, in my experience, has kind of been a rubber stamp. We haven't, at least I haven't seen attorneys raise that issue very often. The other thing that I'd say on that's interesting to me is the question of, whether having them, as Judge Jacot said, a stranger placement, right, non-relative care closer to the school of origin versus a family placement outside of their school of origin. But the question I'd have is, let's say we could transport them an hour to their school of origin. I'd be interested to see how that commute time plays into it as well, because that's a big factor for kids too. And theoretically, if we could solve the school of origin by putting more money to transport, would that be an effective solution, or would that not because of the transport time? So that's just one of the research areas that popped in my mind.
That's very well said. I was speaking with one of the coordinators for the transition to independence or the ILP program, and that was one of the points that she had made. Is it's so difficult sometimes to do that cost benefit analysis of when do the barriers to something like staying in the same school, like if outweigh the benefits, or when do the costs outweigh the benefits? And so I think that is a really interesting question that would be difficult to answer and maybe would have a qualitative component to it.
So Pamela and Ellen, I just wanted to make sure we did a time check here. We could go to next steps and know that we have the webinar coming up soon. That to your note in the chat, Ellen, yes, much of the information they saw today will be also part of that webinar.
Perfect. I just noted that Seema had her hand up for a moment, and it seemed like Deanne had a question as well. So I wanted to make sure that they had an opportunity to ask their questions before we moved on to that next step.
Thanks, Ellen. I think some of it, my questions got answered, but I was just like thinking out loud, do we have, and I very well could be missing a piece in here, like, yes, we have the data to support this to some extent, but is the school district involved? Like, do they have any programs in place to catch, like historical data on kids transitioning from district to district, like how many placements they've had, impact on their education. I'm just wondering if we have something in place, because if agencies sort of partner together, maybe that could be some form of resolution moving forward.
Did you say at the district level, Seema? Or at the school level? Wait to track that.
Yes, like almost like, you know, all districts, because sometimes you see kids being placed, although DHS does try to place them within the same district, but they move further out. So is there some sort of communication that is consistent statewide, that, you know, a child's care is not dropped in transition? I couldn't find any such process in place. That's why I'm like, enlighten me.
I don't think there is any, particularly around the educational outcomes. Unless there's a smooth, like a handoff around IEP, if someone would have to speak to that. I don't know that system very well. But for those not in an IEP, for sure, I have not heard of anything.
I can only speak.
Go ahead.
I was gonna say I can only speak towards my own experience regarding that, but I'll wait until after you're done, Seema.
Oh no, that was pretty much. I'm just like thinking this is almost like a you know, if a policy has to be implemented in the future, obviously involving all key stakeholders, it is important, and not sort of duplicating programs that exist. I think that's what I'm trying to think. But I think, Pamela, you answered it, so.
Oh, is it my turn now?
Yeah, go ahead.
All right. And oh, I'm in the living room, so if you hear some noise, that's what it is. So from my personal experience regarding all the mobility and everything, and the IEP stuff. So for mobility, I went into foster care on the east side almost immediately. Well, actually, no. First, I was with some family friends for a few weeks. Once I reported my mom's abusive partner at the time. But that's a temporary placement until they found like an actual foster home placement. And then as soon as that came, all of the options were on the east side. I was on the west side near the Multnomah County Library during that time. And so I had to also be driven to middle school, Robert Gray, during that time. I believe that was a choice that I made, for the record. But yeah, so every foster home that I went to was on the east side of Portland, and specifically after the first two, which were temporary, one for 1 night literally, and then one for a couple months, or like a month or so. Then I went to one east of 82nd. And it seems that there's a lot of foster homes near the Gateway area. And in particular, I know for a fact that a lot of Ethiopians, like the Tigrinya population and the Somali population, are big in the foster home industry right now. And they tend to be dispersed in East Portland, so like east of 82nd, at least near Gateway or Mall 205, it seems. So in regard to my personal experience, that's the experience I had. I ended up going to Douglas High School right after, because I was in the second year of middle school during that time, if I remember correctly. And the mobility thing, well, Dave Douglas was very close to where I lived, so I cannot really talk on the mobility issue in that regard. After I left West Portland, and that my mother then basically started traveling, though she did live in Milwaukee for a little bit, but then she started traveling. So mobility never became much of an issue in my situation. But I think my situation was relatively unique as well. So, but that's all I can answer regarding my experience with the mobility issue. And then regarding the IEP issue, the reason I was saying that I could only talk to my experience there is also unfortunate because I did not memorize those meetings. So I can't provide more specifics on that. So, and that's unfortunate because I should have. Then again, I wasn't on the commission at the time, so how was I going to know that's going to become important? But yeah, that's essentially all. That's all the info I can give here. That's all the info I can give here at this moment. So.
But I think you raised a really good point, a few, but also just kind of speaking to that transportation piece early on, and that's something that a couple of others of you spoke to as well. And it really does also highlight the issue that, you know, an intervention is only as effective as it can be applied. And, you know, in my experience, there were many youth who were being transported to keep them in the same school, but there were all kinds of breakdowns in that process. You know, this is just one example. And so while it may have been in the child's best interest to be able to stay in the same school, in practice, they were oftentimes not getting picked up, not being, missing school because of transportation issues.
Yeah, I was relatively fortunate in that there was no real issue in the middle school thing, and then for the high school, it was like just a few blocks away, so I could feasibly walk there, like 10 blocks or so, if I needed to. So, but that's a very specific situation, which is why I'm not sure if it's applicable for general knowledge. That said, yeah, I can see how that would happen. Then early on, if I remember correctly, it was actually social workers doing the transportation for me in 2012. And then I think my school arranged for a special bus that would still do the others, but also transport me back to my home, even though I was like way out of the way. So. During middle school, I mean.
That's really helpful. Thanks for sharing.
I just would throw out there one other thing. Thank you, Ellen, yes, for sharing about the webinar. There will be a lot of the same information covered, although for those of you who are interested in learning more about our findings from the broader mobility analysis, we will have a longer focus on that piece, as well as bringing in a few more figures and facts around the foster care analysis too. And I would say the other key benefit is that just based on who has registered so far, I think we're going to have a really nice mix of participants sort of from different levels of practice, researchers, practitioners, policymakers. And so, and we do, I'm hoping we'll have an opportunity to have some breakout discussions. And so I think it would be a nice opportunity to just hear from more community members around the state. And get to know sort of the thinking around some of these issues from a broader audience. So we hope you can make it. And then I think we'll pass it. Let's see, do we have anything final?
Oh, were you talking to me specifically?
I think we're just going to wrap up here. And we just had a next step slide that talked about the webinar. It has the link. I know Ellen also included in your agenda. And then, like we said, we have those upcoming analyses that we're doing, which we are happy to come back and talk to you about. And then also, if you ever want to ping us directly and, before you hear from us again, please do. And we hope to see everyone on the webinar. And please feel free to share the information with anyone you think would be interested. So I think we can hand it back to Pamela and Ellen, and thank you for having us.
And we will share those slides. Thanks so much.
Absolutely. Wonderful. Thank your team so much. Again, we really appreciate you coming and giving us these presentations and keeping us updated. And I think from our lens, anything you can do to continue to highlight the foster care population as you carve out data sets we would be very interested in seeing and continuing to keep updated on. So thank you.
Nothing.
Wonderful. Well, I believe we are up to a break. Do we go, Ellen, looking at the agenda? I don't know.
Well, we also have April coming at 11, which I'm noting it's really like a minute away from 11. So, but she's not here yet. Do we want to take like a 5-minute break and have everybody just jump back on? And because we've had a long period of time here, and then I'll stay on, and if she gets on.
Okay, so 11:05.
11:05.
Sorry for
All
the
right.
quick, we'll try and give a longer one after April talks. Thank you.
Hi, April, can you hear me? Oh, there you are. Hi. We had such a long presentation that everybody took like a 5-minute break, so they'll be back in just a couple minutes. And actually 4 minutes. We just had kids, so I'm hanging on to just be here with you. So thanks for your patience. Did you have any questions or anything that you need that?
Talking to me?
Yeah.
I don't think so. I'm gonna share my screen here.
All right, cool.
Just trying to get that going.
Hi, Stacy. Good to see you.
Hi there. I was listening to the presentation. I just was off camera. having a little snack, but great presentation.
Yeah, it really was.
Yeah.
That was really, really informative.
Yep. Yeah.
And really good.
Mm-hmm. I think I saw Kim pop on, but no, I don't see her. Is she on?
Yeah, she was here. Maybe she popped back off.
Yeah. Everybody, welcome back. Sorry for the short break on this one, but I think we can give you a little bit more of a break after we connect with April, but it's a very busy schedule, so we want to make sure we honor the time of our speakers and our guests. So are you ready to pass it over to you, April?
I'm trying to get all my screens right. They don't love me today. Good morning. Is it morning? April Flint-Gerner, she, her pronouns, Child Welfare Director with Oregon Department of Human Services. I believe the topic on agenda is an update on the Wyatt settlement litigation. I will probably take up most of my time talking about that. So if there are other really important things that we need to talk about, I'm absolutely happy to stay on if you all want to give me a little bit more time. Let me go ahead and share this screen. I can do that, 2 things at once. I really can.
Yeah, April, I think the one other thing that has come up from a commissioner is the independent living program in Multnomah County and disruption in providers and what's happening there to make sure our youth are getting continued services and supports.
Yep, absolutely we can. Can you all see the slides and not the PowerPoint situation? Okay, thank you. And I'll try to be pretty quick about this. I think some of you who maybe listen to an OPB, Think Out Loud news podcast, or if you're a part of the Children's System of Care, may have heard some of this, so apologies if it's on repeat. But just wanted to take an opportunity because it was asked for to provide a little bit of an update on the Wyatt v. Kotek class action lawsuit and where we are with the settlement agreement that was reached in May. So just to give a little bit of brief history, a couple of key terms, and then to talk a little bit about what's next. So there was a lawsuit filed against Governor Brown at the time and ODHS, specifically related to children experiencing foster care. At some point briefly after April 2019, when the original lawsuit was filed, there were additional plaintiffs that joined as a part of that lawsuit, including Disability Rights Oregon, with a plaintiff's attorney out of an organization called A Better Childhood, or ABC. You may have heard of Marsha Lowry. And so there is a group of plaintiffs that brought suit against ODHS and the governor's office. They were representing 10 children or young adults that were named plaintiffs in this lawsuit, but they were a group of young people who were representative of what the plaintiffs felt were an entire class, which is why it was a class action lawsuit. That class was certified and basically saying, yes, there are a group of folks, young people who have experienced foster care, and young adults who meet the definition of that class. And there were some subclasses within that original lawsuit that were of particular interest to plaintiffs, really claiming that children and young adults who, had qualifying disabilities, children who were a part of the sexual gender minority group, and that transition age youth were all at risk of not getting the things that they should be getting from the child welfare system. And that class was certified, and the court, between the filing of the lawsuit and today, really narrowed the scope of that class. At one point, it was every child that experienced foster care, and it really then kind of lands around young people and young adults who are who meet the definition of the class that was certified. So it's not every child that is served by child welfare, but specifically certain young people, given the criteria of the class. Between the filing of the lawsuit and 2024, we had many conversations and opportunities to work with plaintiffs. I can't really comment on anything other than the current settlement agreement that we are in, but we absolutely worked hard over the last several years to get to where we are today. In May of 2024, we reached a settlement agreement that is not finalized quite yet. That settlement agreement that we've reached will not be binding and fully ready for implementation until we have had a fairness hearing, which has not happened yet. That will happen in September, and I'll talk a little bit more about that shortly. But the settlement agreement really is focused on improvements over the next 10 to 12 years for child welfare, with special and specific attentions definitely to the subclass groups. If there are a couple of other key things that we're going to be focusing on that we agree are areas that need continued transformation in child welfare. And so where we, that narrowed scope of the settlement agreement isn't that, everything in child welfare is going to be perfect, right? Like that's not what it's focused on. It's focused on the class, the assertions that the plaintiffs were bringing forward around this group of young people, and where we have made lots of improvements, there are still lots of things that we need to continue to work on, right? And so this settlement agreement that has been preliminary approved, I will talk about some of the kind of areas of the settlement agreement that I think are a particular focus, are a particular focus for child welfare at EHS and the state, as I think they will be important for you all to hear about as well. And we are, quite frankly, we're excited to get to a place where we can proactively come together with parties, both at the table to cooperatively continue to move forward what we know needs to continue to transform in this system. So a little bit about what is in the settlement agreement. I'm absolutely happy to also provide a link to the copy of the full settlement agreement at the end of this conversation. But if you were to unpack it, it's kind of a little bit what's on the screen here. Really the goal, we took so long to get here. I think people ask folks, why did it take so long to get here? Because we needed to get to a place where we had something that we really felt like we could continue to build on the good work that's been happening. And this settlement agreement not only protects the progress that we've made over the last 5 years, but it also allows us to continue on focusing to reform and modernize the child welfare system based on where we are in 2024. Our entire nation is shifting its focus in terms of child welfare, really trying to get upstream and focus on prevention. That doesn't mean that we don't have lots of things to work on for kids who are experiencing foster care right now, But if we aren't serving the right kids at the right time, the right families at the right time, if we're serving too many of the wrong families, or we're using our system to criminalize families or surveil families unnecessarily, then our scope is too diffuse. And then we can't do a really, really good job at what our core mission is. And so this settlement agreement allows us to kind of build on some of the progress we've made around focusing on keeping families together safely, and not focusing on continuing a system that's built on separation only, to achieve safety. And we've really, I think some of the things that you all have probably heard about, we've built this whole continuous quality improvement program. And we really wanted to make sure in the settlement agreement that it continues to build on that CQI program, to monitor and analyze our data in ways that help us to know where we should be heading next. I mean, in my opinion, we're never going to stop transforming the child welfare system. We're never going to stop using our data to inform what needs to happen next. It gets really hard if we're trying to do everything all the time, all at once. And so the settlement agreement also gives us an opportunity to laser zoom in, focus on some areas where we know we need to focus. But in some ways it doesn't then say, well, we need to transform the system by creating a CQI system. We already created a CQI system, right? So the narrow focus of the settlement agreement, again, allows us to build on some of the progress we've made and continue to move forward. So each area of this settlement agreement aligns with the areas of practice and outcomes for children and families we're already focused on, but specifically around that narrowed class. So a couple of things that, folks are really worried about children being safe while they're in our care. Folks shouldn't be worried about children being safe while in our care. What is the point of having a system that is where we are proposing that children need to be separated from their families to be safe, only to not experience safety in out-of-home care? So maltreatment in care is absolutely a focus of this settlement agreement, and reducing reentry rates, right? So, on one hand, we could say, yep, kids get to go home quickly, right? We want kids to stay with their families, but if it's not done so safely, and it's not done so in a way that helps families to be able to maintain that safety, then we tend to see our reentry rates run through skyrocket. So I'm not saying, hey, everybody's got to send all these kids home and do so with naivete, or not solid case practice and not solid safety practice. No, we need to have solid safety practice. Solid safety practice that helps us, again, to build on the things that we're good at, but allows us to take a really good look at what is it that helps us to know that no one is worried that the issue that brought a child into care is either being, or even a new issue is happening while they're in foster care, or that we are sending kids home too quickly without the supports that they need to make sure that they can stay, and that it sticks. We are going to be looking at improving our timeliness of case plans, because that really is the primary tool through which we need to be engaging families to understand not only why they're involved with our system, but exactly what it is that families need to integrate, incorporate, get through to build safety around their children. It's not about compliance and a checklist. It's about, these are the spaces where we think that families are going to grow those skills that they need to make sure that they're prioritizing children's safety. If they don't get that in a timely way, and if it's not quality, then we have lost our bridge to families in order to help them navigate our system. Improve the timeliness of our assessments, our medical assessments, dental and mental health treatment being kind of the focus. Obviously, when I think of timeliness of assessments, the core job of child welfare is to assess child safety. And so I'm never not thinking about improving the timeliness of all of our assessments, but specifically related to this settlement agreement, it was really focusing on medical, dental, and health treatment, mental health treatment assessments, because again, we don't want children to end up having less access because they're in foster care, or not getting what they need, or what my child might need. I'm going to make sure that every one of our children that are in foster care are getting what they need and those assessments done in a timely way. To increase the stability of placements and the quality of those placements and services, I think sometimes people think when we talk about placement capacity, we're talking about number of beds. We've got to get out of that mentality. Yes, we need number of beds, but we're not talking about Legos that we're putting into a box, right? That's not, we're talking about children. Are the people that are providing day-to-day care for the children that we are serving, are they resourced with what they need to feel confident, to feel competent, to feel like they can offer that child love and acceptance and belonging, and that they have the right supports around them to do so. And so the quality of placements, and I think that's a conversation that is about more than just child welfare, but we absolutely have a responsibility to keep working on placement stability and quality of placements. We're looking forward to the settlement agreement continuous to give us some levers to keep looking at that. And then improving our communication and partnership and engagement with our courts, attorneys, children and families specifically about harm while in care. We've had too many young folks come back later and say, something happened to me while I was in foster care, or I went home too quickly and people weren't listening to me. And I think we've got a lot to do to humble ourselves and listen to the people that are most impacted by the system, which are young people and parents and resource families, about it shouldn't have to be the magic key of the day or the magic code for people to say, hey, I need help, or hey, something bad has happened, to get consistent attention, and how that kind of feeds into our CQI system. And if anybody's raising hands, I can't see it yet, so I'll take a pause here in just a moment. Let me get through a couple of these things. So one of the biggest things that happened in the settlement agreement is that we really we achieved a settlement agreement that recognizes the significant improvements that have been made in Oregon, and it also is a neutral, we're calling a neutral-based settlement agreement. So many states who have been, defendants in lawsuits like this often have like what they call a federal court monitor. And if you were to go and ask child welfare staff and agency staff what that feels like, it feels like somebody who doesn't know child welfare has come in and taken over. And that's not what we wanted. We feel like we have amazing leaders in this organization who really, really care and are, have dedicated their lives to trying to, see improvements happen in the system. We want to be able to leverage Oregonian expertise, people who know their communities, people who are passionate about the work that we're doing. That doesn't mean that we don't need help, but we really believe that we have the right leaders at the table, and that what we need is some capacity building, some technical assistance, someone who understands child welfare to come alongside us and say, yep, y'all got, A through M in the recipe down, but N through C, you're missing these 12 things, or whatever the number is, right? And that neutral-based settlement agreement then really says, we want somebody who knows child welfare and who has done some of this work before to come alongside us as we continue to transform our system, not come in and lord over us as we try to transform our system. We can do this as a state. And so that settlement, that neutral was selected. His name is Kevin Ryan. Kevin Ryan is someone who's got lots of experience providing this kind of work, although he is considered a monitor in other places. That is not the nature of the settlement agreement. He has to come in and do what the settlement agreement says. So he can't just come in and do, some cookie cutter approach. Maybe that, might happen somewhere else. He's got to really have his scope of work is limited to what this settlement agreement says his role is. He's got expertise leading child welfare system in other states. And he also has served as an expert in these kinds of settlement agreements in lots of different capacities. His job is going to be to come in and provide an initial assessment of the system specific to the scope of the settlement agreement to the federal court by April 2025. That means he's got a very short window of time to come in and partner with lots of folks real quick. So we're still working to get him on board. As I mentioned before, we don't actually have a fully executed settlement agreement until after the fairness hearing, but we're working fast and furious to try to get him on board as quick as possible so that he can start doing the deep engagement with Oregon. I am absolutely sure you all are going to have some engagement with Mr. Ryan, and we look forward to working with him over the next several months for that initial review. And what that initial review might really look like is, here are the areas within the settlement agreement that I'm supposed to be looking at. Here are the things that I think that, you know, Oregon has already done and places that they can build on. Here's some areas and things that they really haven't. And that then we can say, what would improvement look like in this particular area? And so, yep, you all can make a peanut butter and jelly sandwich, but your jelly is going on the outside of your bread. You know, your crust is bigger than the rest of the bread. And what improvement would look like is that within the next 10 to 12 years, you get that jelly on the inside, you get your crust to bread ratio where it needs to be. And those are the things that will get put down on paper for us to continue to work for and work toward. And so in some of these consent decrees and other places where there have been settlement agreements, they might say something like, we want 100% of all of your foster kids to get a peanut butter and jelly sandwich within, you know, the next 5 years. Right. Well, that might not actually be what those kids needed. And when we only base it off of a number, we don't know the quality. That peanut butter and jelly sandwich might show up any kind of way, right? There's just a bucket of peanut butter on the porch and a loaf of bread is dropped off in the backyard, right? We want to make sure that as we are working with Mr. Ryan, that we're really understanding what quality looks like, so that as we set apart or kind of measured for improvement, that it's done so in the context of Oregon with our community, and that we are really able to name what it is that young people should be experiencing and how we get there. So he will be also providing that an annual review between 2026 and 2034, 36. That just even sounds wild to say those numbers out loud, and we don't have, you know, levitating cars and things like that yet in place, George Jetson. But that over the next 10 to 12 years, he's going to be coming back and saying things like, okay, of the 4 things that, you know, Oregon said they were going to get, you know, they were going to improve once I came in and did a look and we decided what improvement looked like. Well, 3 of them are done. Well, they're going to fall off. They're going to fall off of our requirements list as soon as we have made those kinds of efforts to do the things that we've agreed between Kevin Ryan and our state are those improvement areas. And then maybe in the last 3-4 years, maybe we're only focused on one, the one that's really hard, the one that's really sticky, we might still be working at. But the idea is that as we show that we can sustain progress on some of these things, then they're not going to be reported on anymore. So my hope is that we make really great progress in the first few years of this, and that we exit early. Let's see what happens. Okay, so real quick, and then I'll stop for questions, and then if there are other things that you all need time with me around, I'm happy to stick around if necessary. So a couple of the areas, like I mentioned, that are of real concern are maltreatment and care, our placement stability and quality of placements, first placements with kith and kin, and then obviously the subclass areas. These are not areas that were only important to child welfare and to me and to the governor's office and to Fair Boards because of the lawsuit. These things are important, period. But the settlement agreement gives us an opportunity with some help, quite frankly, to really dig in around the things that are keeping me up at night, right? The things that are keeping our workforce up at night, the things that are keeping young people up at night around. And so I'm just going to talk about one of these really quickly to kind of highlight why we're excited about the settlement agreement. I know that sounds like a really weird thing to say, but one of the things that we've learned as we dig into our data is that our maltreatment and care data looks a lot different than most of the rest of the country. And here's what I mean by that. Our maltreatment and care rates look inflated for a few reasons. And when we built our CQI system and have done a better job at being able to transparently look at our data, and we really started digging around, because 8 years ago, we had lots of data. That wasn't the issue. Could we actually look at it, analyze it, extrapolate, some themes, and really figure out what's going on? We are able to do that so much more quickly now. And so, we don't need to wait on Mr. Ryan to come and tell us that there are things that we need to fix and that we need to work on, right? And so when we dug down and started to look at our maltreatment in care, one of the things that that happens is that often young people, after they've left the dangerous situation in their family and in their community, and they've gotten to foster care and they're with a resource family, sometimes they end up disclosing things that happened before, but they disclose them while they're in foster care. The way we track things in our system, it looks like that abuse happened now, like the date that it was reported, not the date that it happened. So when we take that out, our maltreatment and care numbers go down. We also, our maltreatment and care numbers look inflated because of our trial home visits. So Oregon uses trial home visit status for almost all children who reunify with their parents. So that trial home visit extends what we call our foster care episode. So if that child disrupts and goes back into care or re-enters care for any reason, and I'll tell you, I'm going to put a pin in any reason, our maltreatment and care rates then are impacted. That any reason could be that another child in the home, they get into a fight. They get into a physical fight, and a child is bruised. Because of the way that we define child abuse in our state, anyone can be assessed for child abuse. So sometimes we see things like maltreatment and care that are not actually about a parent abusing a child, the same issue that brought them into the system. Sometimes it's things like the fact that we assess minors for child abuse. So other children in the community, for example, if something happens at school and it causes a disruption, or even if it doesn't cause a disruption, because that foster care episode is still open, it looks like those children have been abused in care, right? And then, so kind of brings me to the third point, that we have a wide definition of who can be assessed for child abuse in our state. So third party, what we call them, or strangers, when children experience harm by other children or any other adult while they're in foster care, it's assessed. And when it's founded or substantiated, again, it makes our numbers look really high. If you were to go to another state, none of those things would count towards maltreatment and care. And so when we talk about our data and how worried we are that there are a lot of children being abused in foster care, we need to be very careful about just picking an arbitrary number and say, no children should ever get hurt in foster care. We don't want children hurt ever. But we need to be very clear about what our data is telling us, so that our strategies are going to actually match what our intent is. Our intent is that, obviously, young people don't get hurt in foster care. If they're telling us about something that happened in the past, then we probably are less worried about that thing having happened this week, right? We're working on through, the implementation of Senate Bill 4086, trying to get out of the practice. Our hope is that we get out of that practice of assigning children as child abusers. That'll help our numbers, right? So what I'm hoping that Mr. Ryan comes in and sees is that we're using our data to really inform our transformation. Because what I really want to focus on is not those three areas. I really want to focus on you are in foster home and some adult that was responsible for caring for you has done something to hurt you. That's what I really want to focus on. So that's one example of where we think that Mr. Ryan is going to come in, see us already doing the things that we need to do to clean up our data, to be more clear about what we're talking about, so that we can then focus on what is it that we're actually really trying to improve. And then the last thing I will just share with you all, if you all are interested or you are working with young people who might be interested in learning more. Young people have a right to, let me get this slide, sorry. Young people that are represented in this class, nearly 5,000 children and young adults are represented in the class. Any of them can write a letter to the court with the support of their attorney, and any of them can attend the hearing. But according to the rules, folks have to kind of give a heads up to the court that they're interested in learning more, or that they're interested in attending the hearing. And so the fairness hearing, and I have another slide and I'll share these with you all, isn't happening until September 12th. But all of these young people have an absolute right to have their voices heard at that fairness hearing. And so if there are young people who, one, you know, that fairness hearing is saying, do you not think this settlement agreement is going to fix the issues that you all were concerned about? Or what do you like about it? What do you not like about it? You know, we didn't go to trial, so some of these young people didn't have an opportunity to share their stories in the trial, but the fairness hearing gives people an opportunity to kind of represent their voices. And so what is being asked is that if young people and their attorneys want to write in anything, any reactions to the settlement agreement, or anything that they're hoping comes from this, that they send those letters to Judge Aiken, as well as our defendant team with the Markowitz and Herb Boyle attorneys. The contact information is here. I will also be sending this information over after the presentation. And then the fairness hearing is September 12th at 10 a.m. In Eugene. And so there are several things that are going to be happening over the next several months. Listening sessions. There's a video that's going out to talk to members of the class about what the settlement agreement means, what the lawsuit was about, et cetera. And I think these things will kind of be reiterated in those listening sessions as well. I think that's probably all I've got. Question.
Thank you, April. Really appreciate you putting that together and sharing that.
I don't want to take credit for these slides and information. These slides were put together with Disability Rights Oregon. So we are kind of talking about these things together as both plaintiff and defendant, trying to do this work more collaboratively. I just saw you, Jamie. Hi. I'm really excited to see your face. We go way back. We are happy to keep coming back and just providing updates. Right now, the scramble is trying to get the project team pulled together because they're, you know, you all heard about, we've got one manager that's been over temporary lodging work. There's some good things and bad things about just having one person for an entire settlement agreement, trying to manage all of the work. So we've learned some things. So tomorrow, Rachel Kearns-Henry, myself, and Lacey Andreessen will be going to a consent decree convening by Casey Family Programs, actually in Minneapolis tomorrow. We're going to talk to some other people who've been there, and I'm going in there with my notebook, right? Like, what did you learn? What do you wish you knew from day one that, you know, you can tell us? We're not the first people to go through it, but we're going to be the best. You watch. And so I think one of the questions I'm going to be asking is about, like, if you had it to do again, who would be the team of people that were responding to this? Not one person for a whole state system. So we're scrambling to try to put a response team together who can work with Mr. Ryan over time, who can come and talk to y'all, who can come and partner with other advisories, those kinds of things to make sure that we are being communicative, transparent, and really not duplicating what we already need to be doing to improve our work. So, for example, I don't know if you all have heard, we're in, I think you probably have, that we are in the middle of what we call Child Welfare Fed Fest, our Child and Family Services Review. If we already have to do a whole assessment of our system, why would we have Mr. Ryan not just participate in that, right? Like doing all of these things that would get in the way of the work. If we're going to have to write a program improvement plan, why wouldn't we just have Mr. Ryan involved in the writing of our program improvement plan? So we've got like one case plan for child welfare instead of 30 different things. So we're kind of just scrambling to get everybody prepped, ready to go, and moving forward with the benefit of all of the other people who have gone through this. Let us know if you have any questions. I'm happy to keep coming back and chatting with y'all about what's happening. And then you'll probably be hearing from our lead program person regularly as once that person, once you figure out what that team looks like.
Yeah, I have one thing, but I want to open it up if any commissioners have any questions or feedback. I'll let you jump in first. Yeah, so and then I'm sure this will come as your project unfolds. But I've done a lot with the agency when I was there and before I worked there around abuse in foster care and what that process looks like, what rises to level of abuse, how are those investigated? You know, I was there when the process got moved out of child welfare and over to, now I'm blanking on their name, Otis, are they there now? But I guess one thing I would flag is, you know, youth, there was just an article after all this came out, youth coming out and saying that actually the reporting is underreported, that even the data that you have that you said looks inflated to them actually looks way too low for what they're actually experiencing in the system. And so I just hope that as you guys unpack that data, get that all cleaned up, that's great. And we still have homes that aren't of a quality that is therapeutic, trauma informed, or helping youth heal and thrive. And so maybe it doesn't rise to the level of abuse by statute. It is not a place where we want our kids in care. And so I think when you've got kids coming out of care and they're reporting these things that happen, I've been in meetings with you all where you're like, nah, that doesn't rise to the level. But it's like, okay, it's not statute. And is it good enough for our kids who've already experienced trauma? No. So I think this is my own personal hat anyway, want to keep that lens in mind that maybe it's not abuse that rises to the level by statute, but is it certification violation? Probably. And if not that, is it still like a quality? Is this the healing, healthy, trauma-informed home we want our kids in? And that's what I go back to. And we've talked on this commission before about, you know, is general foster care right now able to meet the needs of the level of kids coming in? And especially as you close the number of kids coming in and you get more acute complex cases, I beg the question even more actually, is general foster care able to meet their needs? So I think as a commission, that's something we'll be looking at more of. And I think it plays really well into what you guys are looking at as part of this lawsuit.
I couldn't agree with you more. And I think, you know, because we have to be careful about not expanding the scope of what the settlement agreement, that's why it's like, okay, that's that part. We've got system transformation. We've got, at the end of the day, if any young person is saying something's happening here and I don't feel loved, accepted, like I'm getting what I need, and furthermore, there are things happening to me that are not good, that's not okay. It wouldn't be okay for my own kid. It's not okay for any of our kids in foster care. So that sense of like, how do we use our continuous quality improvement system to know and have confidence that if we have to remove a child from their family, we are not setting them up for, right? Knowingly setting them up for not getting the best that we can offer. And that doesn't mean that things don't happen and that humans don't make mistakes, but I think there's a difference between humans making mistakes and us in some ways turning our eye to maybe systemic issues that could be going on with how we are coaching and mentoring and really saying to our resource families or to any caregiver, what does excellence look like for this child and how are we going to partner around being accountable to that is more important than a settlement agreement, in my opinion. So don't disagree. I think that GFCAC is going to be a great partner with Kevin in the accountability around this settlement agreement and beyond. So thanks for having me. I know you wanted to talk about something else.
Yeah, there was a question, Malik. I don't know if you are able to jump in around ILP if you have a moment, April, to stick around.
Yeah, just wanted to kind of check in about where you guys are at with securing a contract holder for Multnomah County IOP. Like I'm with New Avenues, and I know we were previously the holder for the contract and recently let it go. And just wanted to see where you're at with that, and also if you were open to just some like feedback and stuff that I've heard from our team and from those folks about why we, it wasn't sustainable for us. But yeah.
And we start with the feedback as my gentle ask. I think we dropped Kim Keller off, and she's probably got the most spot on timely update on Multnomah County, but I'm sending her a message to see if she's got an update.
Yeah, absolutely. So I think the biggest issues that we were experiencing were that the contract's budget wasn't sustainable for providing services. And just the whole process of also just getting funded and like was very kind of like jumping through hoops to get money for the kids when we were in program and things like that. And obviously just like a lot of things that needed to be met that were really just hard for staff as well as leadership that was, navigating those things. I think another component is obviously being the only provider in Multnomah County at this, at the time. Caseloads for, our ILP workers were like pretty intense to a point that, needs weren't getting met. And, youth are trailing off as things, it happens, but it doesn't mean it's okay. And I think a lot of that was just we weren't able to, the financial component of being able to staff appropriately versus what we were getting wasn't just there. And I think for a lot of, at least for the ILP team and leadership specifically around that, we're feeling that like we were kind of running into a deficit and we were having to pull money elsewhere to provide those services and programs to meet the needs of IOP at the same time. And it was just like, we've been doing this for a long time, obviously, a little less than 10 years, I think, we've had it, but, was really hard to have to like let that go, obviously, because, we love working with our youth and everything. It just wasn't sustainable, at this point. Yeah, that's kind of just the big takeaways that I think for at least the feedback I've gotten from the ILP program. But yeah.
Yeah. So let me tell you what's been happening, I think, since the end of the New Avenues contract. Lots of ELP providers have been, coming forward, sharing similar concerns about sort of rate structure, right? Like, I think, I started out in ILP, so I've got the soft heart for it. I know how hard the engagement is, and that there is no current national best practice like rate structure or model that exists, especially in a world where back when I was doing like the first dinosaur version of ILP, what you did? You had to like call on a payphone and go drive out there, right? Like that was engagement. And, one of the things that we were asking for with the Children's Bureau, I called our old director, Rebecca, and said, here we are, in one way, we used to kind of have this rate structure that in some ways we couldn't keep up we couldn't keep up, like, here's a bunch of money and we can't say how many young people need to be served. Like that wasn't going to work. It's not going to work. We have to move away from that. We are just being held around greater accountability around how many young people are being served and how many of them are being served well as we talk about paying for things. I think the bridge process has been trying to get to that pathway, but it still isn't the perfect math to both make sure that people can keep their doors open to do quality work and that we're maximizing out, the number of young people. I can't out of one side of my mouth say that the numbers aren't everything, and on the other side of my mouth come and say the numbers are everything, right? If you serve 10 kids and you do it really, 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 really well, is there a monetary value for that that's different than you separate 100 kids and not doing it well, right? Like it's a hard math conversation that nationally we haven't figured out. So one of the things that, and I called Rebecca, I said, has anybody figured out some sort of formula that really helps agencies keep their doors open, get incentivized to do great work, and that allows us to kind of maximize out on our engagement of young people? And she said, no, but it might be a really interesting, to her knowledge, it might be an interesting thing that Oregon could really make progress on for the nation. So my commitment has been to work with the Children's Bureau to get some technical assistance in, to sit with the ILP community, and let's figure out like, what's a rate study, you know, because I think one of the things was like, oh, we're going to pay you for, you know, 15 minutes of engagement with a young person, but we're not going to pay you for the 7 hours you spent in the car driving to do it. But the in-person engagement is so much more important, right? So yeah, I get it that a text message isn't enough, but we got to pay for the seven hours that you took doing the drive-in for that 15 minutes because of how important that 15 minutes is, right? So what I'm saying is that I don't think we have all of the answers, but I'm going to tell you what my hope is, that when we get ready to come forward with an ask of our legislature, that we've done so in partnership with ILP providers to say, this is what we think this should look like, to both get to ultimately the quality, to maximizing out how we can engage, and to make sure that it is flexible and adaptable enough for all of the parts of our state, so that what works for Multnomah County isn't necessarily something that ties the hands behind their back for somebody that's in Eastern Oregon, right? So right now we've got these kind of conflicting things that are like one size is supposed to fit all. That's in Oregon. It's just not realistic. So that doesn't necessarily give you a hard, cold answer for today, but we've been having some really hard conversations, but I think some hopeful conversations, because ultimately I think we all want the same things. We want great organizations to have exactly what they need to do an excellent work with the community, and our structures and bureaucracy haven't gotten there yet. So it is a commitment that we have to working with providers and getting some technical assistance. Just like Mr. Ryan, it's like we've taken this conversation as far as we can think to take it. Maybe we're missing something. We're going to get somebody from the Children's Bureau to come in and work with us on trying to figure out what, and maybe it's something that we're talking to the rest of the world about if we can figure it out, because I think there are lots of jurisdictions that are hurting around this. And then let me see if Kim responded specifically about Multnomah. She said, yes, there is another provider that's adding youth for Multnomah County. It looks like there's several folks. There's several providers that are trying to get in the Multnomah County space. And we want to value and recognize that New Avenues has been doing such good, amazing work, and where is the pathway to maybe coming back into relationship with the state through something that makes a bit more sense than what was there, is kind of where we're headed.
Awesome. I really appreciate that. Thank you.
Yeah, and thank you for that on the fly. I know we didn't prep you for that conversation, but
If I can't answer those questions, I probably shouldn't be. I think a lot of times we struggle, and my folks that are here that are on my team will recognize that we are often working on things that you all care about. What we're not good about is tapping in and communicating to you all about what we're doing. I'm trying to work on that. I'm trying to work on it, because we just be in our little lab, and then you never know. Actually, the feedback that you gave us sparked this whole thing. It's now maybe a national conversation, but you wouldn't have known if you didn't ask me that question. So I think we need to probably do a better job about, one, me showing up and giving some of the updates on this agenda. So really happy to participate whenever and however I can. In support of our some of those kind of statewide conversations. And then two, we're going to be looking at some new ways to communicate across things like GSCAC, CWAC, our Parent Advisory Council, and our Service Equity Council, because I think we should all be in relationship with each other, just me, but it would make sense if we all so we got some things we want to talk to you about soon, if we can be invited back, or I can be invited back, around what I think are linked advisories. So something comes up, you want the Service Equity Council's opinion on it, you can toss it to them. Something comes up around family preservation, you want to toss it to CWAC, right? Like that there's some real intention and like maybe an annual gathering of us for some shared things. Really appreciate the recommendations to the governor that, so, if you all want CWAC, PAC, any of the other advisories to weigh in, like, I just think we should probably have more connection across some of these advisories. So looking forward to doing a better job of that this year. Thanks for having me. I think I went over my time and somebody else is waiting on me to open a meeting.
Well,
So
thank
good
you
to
so
see
much.
you.
Appreciate you.
It's good to see you, Jamie. I just spent a lot of time with Jamie in the last 4 years. I hadn't seen her in a while, so good to see all of you. Bye.
That reminds me, Ellen, that is a really good point. I don't know that the recommendations have been sent over to CWAC. We used to have representation that sat on both seats and would, help circulate information, but I don't.
I do not think so. Is that Jessica Glasscock though? Because she would have a copy of them.
I don't know who chairs it now. Does anyone know who's chairing CWAC?
So currently Jessica Glasscock and Eric Welch are the two chair people, and I'm not sure if they have brought on a third or not, but I know that that's what they were looking for, one more at the last time I was at one of the meetings.
Yeah, that's a good, I can make sure that happens because it has happened with System of Care. And
Thank you. It is Warner. I apologize. I just realized I said my old last name. So that was super fun.
It's Monday.
Okay, I'll get it to them. And that does lead me to, we have Adam on here, so he might want even to say something because we've had some conversation and it is on here to talk about the System of Care Advisory Council collaboration and their possible policy option package on the transitional, on the temporary lodging, sorry. Yeah.
I would love to offer a break. We were supposed to have kind of a longer break after April's presentation, but now we're coming up on noon, the last push on our agenda. I wondered if we could take another shorter break.
Sure. Whatever you want.
Can visit the SOCAT conversation, close out with retreat, because honestly, we've already planned a retreat. We had a committee, Jamie was on it. We planned a whole retreat, didn't end up doing it because of all the transition and funding issues and line items, and there's a whole conversation behind that. But we really have the framework there, so it would really be kind of following up on that. So I'm less worried about that and more would love to talk to Adam about their POP coming up. So does that sound good to everybody? A 5-minute break? Yeah, okay. So what would that be? 12:01. We'll make it really messy for you. I'll be right back. Hi, everybody. Sorry, I love to make sure people get adequate breaks. So apologize today that we are so packed that we're getting tiny breaks. You know, at one point, Ellen and I were delusionally thinking we could shorten these meetings to be effective and efficient, but there's just too much to do. So here we are, continuing to go past noon. So the last part of this conversation, well, there's the retreat in the SOCAC, and I don't know, Ellen, how to set the conversation up, but if you wouldn't mind kind of describing, I know you sent out the email and I've had a chance to look through them. I hope everyone has had the opportunity, and then between you and Adam, we can talk about what's happening.
Well, I think I'll go ahead and let Adam introduce this as he might want to, and we can talk as little or as much as we want to about it. Now, I did send the draft out to everyone, so hopefully folks had a chance to review that.
Yeah, apologies, I didn't come prepared to talk about this. So like I said, I was just here to kind of eavesdrop. Yeah, so we are putting together some form of a POP to try and address some of the issues with temporary lodging and child welfare. It's a pretty rough draft right now. Obviously, this group is an important one to consult on, right? Especially with the recommendations that y'all put forward out of the Buyer report. And so System of Care Advisory Council is trying to take that and kind of amplify your recommendations and kind of agree with them, right, to move them forward and continue to elevate them, and then have discussions. And so I know Ellen's been meeting with Anna Williams, who's our executive director, and talking about how our two groups interface to, to support each other and really hopefully take the opportunity to have this POP actually improve care for kids and reduce hoteling. So that's, sorry, that's about all I got.
Put you on the spot. I had spoken with Anna about it, and I know she thought she might be able to pop in and attend, and had tentatively accepted it. But I'm just really heartened to have been invited to your to the legislative group and to attended and heard the interest. And right now, as it stands with our recommendations, I know that it's going to go to several subcommittees or smaller groups. And then there'll be a weighing in, and then they'll bring it back to the System of Care Advisory Council. Am I characterizing that correctly?
Yeah, I think so. And, if we're, in this kind of still between all of these councils that exist, how we work together, right? And, my take on it really is like, System of Care is this all-encompassing umbrella, right? So like we should be letting you all do the expert work on child welfare and then feeding it to us. And we should just be saying like, this group put a lot of effort and energy into that. So we need to continue to move this forward and amplify it and support it instead of, us doing our own thing, right? Which may be counter to what you all are doing actually, right? That's the fear when you all are the experts focused on this area of the work. So yeah, my hope is that we'll be able to move that through some of our subgroups, legislative subgroup, that sort of thing, and then move it up to approval from the full council.
And that would be great. And I just love the idea. It's been great meeting with Anna, but it's wonderful to find ways that we can mutually collaborate to move this work forward in a meaningful way. And I think that helps, that can't help but help reform the system, as we've talked about that, but also help kids is the bottom line, So thank you for that. Thanks, Adam. And then I think the main thing on this collaboration and this POP is just having it for your review, being aware of it, reading it for commissioners, and then we'll revisit it again. I'm sure we'll be talking more about it as you all support our recommendations, and then as you all move forward to know what we can do to help you with the POP.
Policy option package, Alexis. So like move it, basically the start of a piece of legislation. Yeah. Yeah, sorry, we get stuck in the lingo sometimes.
So many acronyms.
And I didn't send that to you because I had only sent it to commissioners, but I'm happy to send that to you. I mean, it's really interesting. So
I would love to see anything that you're willing to share with me. It's interesting the position that I'm in because I'm not I'm not a member of the, commission or anything like that. So I don't know where I can and where I can't. So yeah, whatever you're willing to send my way, I'm super grateful.
great. So I don't think we have much more on that, and we're kind of losing some folks too. Do you want to, should we just move on, Pamela?
Yeah, no, that's fine. And thanks, Adam, for jumping in. And if you haven't had a chance to read through that yet, please do. It really aligns completely with what we were hoping to see. And, when we talk about our recommendations at the last meeting, the next step was, then what? Like, what of this could become a policy ask? What becomes maybe an administrative ask? What's a training and awareness ask? And so I think our answer, the POP answers some of that. Some of the things that we'd want to see are in there recommended as POP. So please take a look at that when you get a chance. Oh, bye, Adam. He's already off. Okay. So the last piece of our agenda, I think, is just the retreat. So set for September in place of our normal meeting in person. I think there's still some background issues with us, right, Ellen, around securing space and having funds and, oh, you're on mute still. Oh, you're muted.
And I was saying something so very important. No issues with having funds. We do have, what we'll do is we'll probably have a lunch ordered for that day, and I'll send out something where everybody can order lunch, and lunch will be covered and paid for. We'll probably have to figure out, I'm going to Salem today for a meeting later and there for the next couple days. So that gives me an opportunity, hopefully, to find out a little bit more about where, because I'm not very familiar with Salem, where we could host the meeting, and where we could, and then where people could stay for coming in the night before. And then I think it would be, and then what I have gleaned is that, and this is also from working with the other people that staff commissions, is that it's probably going to be more of a reimbursement process where I would give you would have the government rate at a hotel, and then that and the agreed upon per diem for whatever your travel, your mileage, as well as probably the breakfast and, depending on, whatever you wanted to claim in terms of the per diem would then also be submitted. And right now, and there is, it would be submitted through trips, through our trips thing that we have. And I would then, there's somebody we can, I believe Donna Haney, she is able to, she's one of the trips coordinator people. So we would go through her, probably having everybody, and she's agreed that she would, could take everybody's trips and process them. So I think that would be great that's probably how we'll do the reimbursement. That way we don't have to do anything in advance. And we're not necessarily using a spots card. I was looking into that, but I don't have one. And we would have, I'm not so sure who does and how it's used in the foster care division. So this seemed to us like perhaps the easiest and most effective way to go about doing it was just to go through the trips, which other commissions are doing, and also to do the hotel. Now, that said, I may be incorrect on something. So we, but at least we know that it's going to be covered and we can go ahead and have this. We just have to get some of these final details hammered out. And I do know that that cafe that we're going to go to is going to be Little Lois, which we spoke about, and I've never even eaten there, but I am going to have a chance to have a little combo from them tomorrow. So I will have my own little recommendations around Little Lois after tomorrow, I'm sure, which sounds like it's a great place that people use for meetings all the time.
Oh yeah, I've had food from there a million times.
So that's kind of the update on that. Does anybody have any questions about it, or are you feeling comfortable about? One thing I will need to know, and we don't have everybody on here, but just as how many people want to come in the night before, need to come in the night before. And we'll do some more follow-up on that. And Pamela, probably maybe you and Jessica and I should sit down and have a meeting and talk about the logistics, because I'd feel a lot more comfortable prior to moving forward if we just make sure we're all on the same page. So if you want to find a time, or if you guys have a time that works for you, you can just send it to me and I'll set something up.
So there's a few of us that it might be worth just sending an individual email to the commissioners and seeing if having to get reimbursed on the back end would be cost prohibitive for anyone, because we don't want somebody to not come because they don't have a way to pay for it up front.
Absolutely. Yeah.
Thank you for pointing that out. Yeah, that's always important.
I do appreciate
especially
that.
if we were a commission, if we had folks filling the youth seats, I think especially we would want to be figuring that out. So does anyone who's here left, I know we're missing some members now, but interested in helping flesh out the final agenda for the retreat? Obviously Jessica and I and Ellen will be looking at that, but anyone who's left here, you want to jump into a meeting with us and brainstorm any final touches on the retreat, you're welcome to just let us know. We'll get you part of that invite, maybe do a doodle or something. I don't know if you can do that, Ellen, send out a little poll.
We could do that if we have that. The only thing is that if we have more than the two of you, then I do have to notice it as a public meeting.
Yeah. I still think worth it to get others' input if they want to weigh in on it.
Yeah, for sure. So I'll get a doodle poll out to folks to see if you want to participate in this.
It'll be kind of a retreat planning session.
I've got a lot of time here in July because I'm unemployed right now, but my firm's officially launching August 1st, and I'm taking a government contract for juvenile. So I really don't know what August is going to look like for me at this point, if jumping into a planning thing.
Casey, what contractor you're moving to?
Lane County.
Oh, good for you.
Well, I shouldn't say that it's not guaranteed yet. I spoke, there's two people. They pretty much told me I can get 0.4, but there's 0.8 available. I'll take it all if I can, but I'll take 0.4 if that's what.
They're a good group. I think that you'll like working down there.
Yeah, I've lived in Lane County the whole time, so it's been a lot of put about 100,000 miles on my car commuting.
Yeah, that's a lot.
Yes.
Before we close out, we'll get this doodle poll out. Anyone who wants to weigh in on the retreat, please jump into that meeting. Is there anything, if you're not planning to do that you here want to make sure we get on the radar for the retreat? Any speakers, any particular agency folks you want to make sure come and present on something? Is there anything you've heard in the last two meetings where you're like, please have OCID come and give an update on X, please have April come back and give is there anything like that? And you can let us know by email too, but if anything like that is urgent, you feel like in a retreat, let us know. We can.
I think not necessarily for the retreat, but at some point in the future, I think it'd be really great to hear from somebody from ODEE about their policies regarding foster care and transitions.
Good.
And I would really like somebody from like a small, medium, and large DHS branch to tell us how they're tracking educational outcomes now, because it really seems like a hodgepodge to me.
Yeah, I'm taking note of that. Agencies.
branches. Tracking.
If they do, right, if they're even.
If they do it at all, yeah.
And we should get Catherine involved in that, because again, that, you know, she is really working hard to have people doing that in the branches. And Malik has his hand up.
Yeah, also not necessarily related to the retreat, but also potentially like any just like as tracking or data regarding like the changes like the measure 110 and like the amendments and everything, and like potentially impacting some of our older youth in care with those new changes and like charges and things like that now being applied, as well as the change to the, and this is maybe really specifically Portland, but the no camping laws and everything. You know, we do have quite a few youth that are street entrenched that are still in care, and this new law and everything's, you know, people getting, you know, fined and potentially some legal OIA involvement. So just curious if we could, anyone that might have any information on that or anything that could potentially, I just think that's like, obviously I see it, I work with houseless youth, but like it's really impacting our community, and I know just recently changed and it's already happening. So yeah, just want some follow up around that.
That's all our youth need is one more freaking thing.
Yeah.
Bye, Jessica.
I have just one quick question. This is probably a dumb question since I've been on the commission for so long, but when does what we discuss become public? I'm assuming once we have a public meeting, we can discuss it with other people because public. And so, you know, most particularly I'm talking about kind of the recommendations to the governor, and then also the information we get about the transitions versus placements. Like that stuff's very interesting to me. I'd love to talk to colleagues about it. Historically, I haven't really, because I just kind of, you know, was like, well, this is to the governor's office. But do you get the gist of my question? Like, are we allowed to just kind of talk about everything that we get?
Yeah. Actually, yes, because it is a public meeting and it's taped and then it's up on YouTube. And so anybody can see it and hear anything that we say in these meetings. And that's kind of the point. And that's again part of that point of that public meeting law. And that's why we can't have a small group of us sitting and talking about something that may be business and then that not being available to the public.
Yeah, so go forth and share and bring information from them back to us.
Yeah, and especially around the things we talked about today, and there's so many important things that I think that were brought up today that I feel we benefit from a greater conversation.
Well, Dr. Cousins hopped on and suddenly there's this whole work around health outcomes, and I'm like, oh God, maybe this will be our next.
We have a juvenile law listserv that includes every juvenile attorney and all the juvenile judges. And so sometimes I'm like, I just kind of want to share this information with everybody because then they could argue it in court.
Yeah, I think that's great. And the other, speaking of, you know, Carissa being with us today, then I've gotten connected with another medical provider with some concerns, and that was a connection through System of Care Advisory Council. So I think it just, the work grows, and as the interest grows and the ability to affect change grows too. Just like even the things Malik brought up, you know, I'd love to hear what the follow-up and what happens more regarding that. As we discuss that more openly.
Yeah, I mean, the ILP, I was going to say this, but Rachel or April needed to head out, but our recommendations they include the ILP program and adequately funding it to meet its goals. And one of its goals is educational outcomes for foster youth. So our recommendations are tied really closely in with this conversation they're going to be having around rates and how to stabilize ILP programs. And Malik, just so you know, the program who was the contracted provider in Multnomah County also left the contract for the same reasons. They could not sustain, they were draining program funds from other parts of their agency to fund ILP programming, and it didn't, like, you couldn't square that financially for them either. So It's not just you, and it's impacting everyone in the whole system, but yeah, so lots to follow up on. The list never ends. We'll get the doodle poll out about retreat planning.